Well, good morning, everyone. Welcome, Minister. Welcome to
Good
all
morning,
the attendees. This is the sixth hearing of the committee's inquiry into budget estimates for 2023-2024. Firstly, I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the lands on which we are meeting today. I pay my respects to elders past and present and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I also acknowledge and pay my respects to any Aboriginal and Torres Strait Islander peoples joining us today. My name is Jeremy Buckingham and I am the Chair of the committee. Again, I welcome Minister Cotsis and accompanying officials to this hearing. Today, the committee will examine the proposed expenditure for the portfolios of industrial relations and work health and safety. I ask everyone in the room to please turn their mobile phones to silent. Parliamentary privilege applies to witnesses in relation to the evidence they give today. However, it does not apply to what witnesses say outside of the hearing. I urge witnesses to be careful about making comments to the media or to others after completing their evidence. In addition, the Legislative Council has adopted rules to provide procedural fairness for inquiry participants. I encourage committee members and witnesses to be mindful of these procedures. Again, welcome and thank you for making the time to give evidence. All witnesses will be sworn prior to giving evidence. Minister Cotsis, I remind you that you do not need to be sworn as you have already sworn an oath to your office as a Member of Parliament. I would also like to remind Ms Campbell, Mr Draper and Mr Dobbins that you do not need to be sworn as you've been sworn at an earlier budget estimates hearing before this committee. For all other witnesses, could you please state your name and position title and swear either an oath or affirmation? And we'll begin over on my left with Mr Farquharson.
Good morning. My name is Stuart Farquharson and I'm the Chief Financial Officer of iCare. I solemnly, sincerely and truly declare and affirm that the evidence now and about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you, Mr Farquharson. Mr Harding.
Good morning. My name is Richard Harding. I'm the CEO of Insurance and Care New South Wales. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you. Mr Curtin.
Good morning. My name is Trent Curtin, Acting Deputy Secretary and Head of SafeWork New South Wales. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you. And lastly, Mr Houston.
My name is Charlie Houston. I'm the Executive Director of Industrial Relations at the Premier's Department. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you very much. Today's hearing will be conducted from 9:15 to 5:30pm. We are joined by the Minister for the morning session from 9:15am to 1pm, with a 15-minute break at 11am. In the afternoon, we'll hear from departmental witnesses from 2pm to 5:30pm, with a 15-minute break from 3:30pm. During these sessions, there will be questions from the opposition and crossbench members only, and then 15 minutes allocated for government questions at 10:45am, 12:45pm and 5:15pm. We will begin now with questions from the opposition. Mr Tudorhope.
Morning, Minister.
Morning, Mr.
Morning,
Tudorhope.
officials. Thank you for all being here this morning. Good day to be here. Could have been yesterday. Minister, how many DLOs do you have in your office?
Thank you for that question, Mr. Tudorhope. I have 2.
And did you request either of those DLOs to be appointed to your office?
Mr. Tudorhope, process was followed.
Yeah, sorry, Minister, could you just bring the microphone a little bit closer, because and all witnesses be mindful that you have to speak right into the microphone, otherwise we can't hear you and it's very difficult to answer.
Sorry, Minister. Oh, sorry. Is it on? Oh, sorry. Sorry, as I was saying, Mr. Tudorhope, they went through a process through the agencies, and they're a liaison between our office and the agencies.
But did you specifically request any of the DLOs which were appointed to your office?
No.
Did your Chief of Staff
No.
seek to request? To the best of your knowledge, are any of the DLOs appointed, or either of the DLOs in your office, members of the Labor Party?
I don't ask affiliation of political parties, and in fact, one of the DLOs actually was in your office as well, providing support and liaison.
So I think the answer to my question is, to the best of your knowledge, no.
To the best of my knowledge, I don't ask people their affiliation, Mr. Tudor-Hope.
Minister, prior to the election, members of your party were, in fact, able to make allocations in respect of the local small commitments grants. Are you aware of that?
No, I asked questions.
This is the local small commitment allocation.
Yes.
Is that right? Yeah.
Yep.
Yes, Mr. Tudor-Hope. I'm aware. Yeah, I'm aware.
So you allocated, in respect of your electorate, a variety of grants pursuant to that scheme?
A point of order has been taken. Mr. Nanva.
Just goes to the procedural fairness resolution and relevance. This hearing goes to the expenditure or the estimated expenditure of funds from the consolidated fund and related budget papers. I'm not sure that asking these questions goes to the portfolio responsibility of the Minister.
Look, at this stage I won't uphold the point of order because I'm not sure either yet. We're only very early into the inquiry and the questioning, so I'm very mindful of what what the member has said. The inquiry has to be relevant to the expenditure in this portfolio area, but I'll allow the questions to continue at the moment.
The idea.
So thank you. Yeah, thank you for that, Mr. Tudor-Hope. And I supported grants to a range of community and faith groups that are dedicated to providing important work in my community. Of course, I'm a very active local member and I have a very diverse multicultural community. And you know, Mr. Tudor-Hope, in my area, and there was some statistics that came out yesterday about some of the lower socioeconomic communities, and my community was affected during COVID.
Thank you, Minister. I'll just cut you short. I've got limited time.
No, that's okay. That's fine.
So I'll
I'm
just
happy
move to my next question. Were you given any guidelines in relation to the grants which you were able to, or the projects you were able to choose?
Mr. Tudor-Hope, I understand that the relevant minister will be up tomorrow, and you can ask a whole range of questions.
But did you receive any guidelines?
I'll have to take that.
Yeah, okay, that's
I'll
fine.
have to take that, but I just to point out, my understanding is that these were part of a whole of electorates process, and there is a process that's being undertaken, and individual commitments are currently going through an independent probity process. And I just wanted to let you know, and the committee, that I have really important non-government organisations that do really important work. The PCYC, our local PNCs.
Minister, I understand that. I was asking you whether you had received guidelines, and that's fine. So did you personally select the projects, or was there someone who assisted you in relation to selecting those projects?
Point of order.
What is that?
I'm very mindful, Chair, of your earlier ruling on Honourable Bob Namber's point of order, and I would now suggest that it's become clear that Mr. Tudor-Hope has failed to make good the relevance of this line of questioning to the estimates for this portfolio. And I would suggest that if you're not satisfied of that Mr. Tudor-Hope could even be asked to really explain how this could possibly be relevant, because I would suggest that it's clear now that it's not relevant. It's just an inquiry into a political matter that is of a level of generality and doesn't relate to the estimates for this portfolio.
Yeah, thank you, Mr. Lawrence. Yeah, I do.
To the point of order,
Mr. Rath.
I think that, previously I mentioned this as well, that, the
Legislative Council Practice, second edition, does say that wide latitude in questioning of ministers and other witnesses is allowed during budget estimates. And in particular, I think that given this is related to the expenditure of public money that's been directed by the minister, I think that it is relevant to the proceedings today.
To the point of order.
Well, no, I'll rule on the point of order. The inquiry is about the expenditure, but not in. I uphold the point of order because to this point the inquiry has been about expenditure outside of the minister's role as the Minister for Industrial Relations, related to her grant funding as an MLA. So I hold the point of order. Mr. Tudor Hope, if you could ensure that your questions are relevant to the terms of reference, which is expenditure in the areas of industrial relations and workplace health and safety.
Thank you, Chair. Minister, did you attend on any meetings with Minister Burke in relation to the recent industrial relations legislation which has been introduced into the federal parliament, which is the third tranche of amendments related and is colloquially known as the loopholes legislation?
So are you asking me whether I attended a industrial relations ministers meeting?
Correct.
I did. And
when was that?
I'll have to get the date for you, but it was a couple of months ago, and this was all states and territories. So this was I'm sure you attended when you were the Employee Relations Minister. I'm sure that you attended a number of meetings with Minister Burke.
Thank you, Minister. So in respect of that meeting, were you provided with a draft of the proposed legislation?
Mr. Tudor Hope, I understand that the proceedings within those meetings, there is a communique that comes out after those meetings. In terms of the information I was provided, I'll get back to you on that. With respect to the loopholes bill, that's currently being assessed through the processes in the federal parliament. If I can help you more, I mean, I'm not sure what you're
well, let me just put you. Would you agree with me, Minister, that one of the really important components of your government's current agenda is housing supply?
Absolutely. I mean, you left us with a big mess that we're trying to fix.
That's
fine. And let me remind you, the Honourable Member, Mr. Tudor Hope, that your government, and if I can take you back to the former Planning Minister, Mr. Hazzard, who could not get his legislation through with respect to planning, and don't start me about planning and the lack of coordination by your former government. But you know, you were in government for 12 years and you had the opportunity to increase
Minister,
supply with coordination around infrastructure. And I have seen in my own community the lack of infrastructure.
Thank you.
And
Minister.
it took Premier Minns and Minister Park to announce infrastructure in my community
Minister,
when it comes to rebuilding Canterbury Hospital. It took us 12 years to get there. And I'm very, very proud of our government and what we are achieving, particularly when it comes to health in my community.
Thank you, Minister. And if I can just ask you this, I have limited time, and if you could just answer my questions, that would be helpful.
But you've asked me about housing supply.
And I'm just
the Planning Minister was here a few days ago.
I asked you to confirm that it was a priority of your government. You've answered that question.
Absolutely, it's a priority.
So would you agree with me that in relation to the industrial relations guidelines for building, construction and procurement, you have put that on hold?
With respect to?
Procurement policy in respect of the construction industry?
What? I'm not sure what you're getting at. What do you mean?
Well, do you understand that there are New South Wales industrial relations guidelines in respect of the building and construction for procurement?
Right.
Do you understand that? You don't?
I do understand about procurement, but I'm just trying to understand what you're
There are
what you're
industrial
getting.
relations guidelines in respect of the government's procurement policy.
Right. So how does this have anything to do with the loophole bill?
Do you understand? Just answer my questions.
No, but I'm asking for clarification. How is this? What does this have to do with the loopholes
So do you
bill?
understand that there are construction guidelines in respect of procurement?
Right.
Did you put those guidelines on hold?
I'll have to get back to you on that.
Well,
I'll take that on. I'll take that on notice.
you don't know whether you made a decision to put those guidelines on hold.
Point of
Point of order.
Point of order has been taken, Mr. Lawrence.
There's been a series of questions about some sort of instrument or policy. If Mr. Tudor Hope is going to put those questions, I would suggest that he should inform us all of what he's actually talking about. Well, what's the name of it? Is he talking about a legislative instrument? Is he talking about an internal departmental policy? I think in fairness to the witness and to the rest of us, he should be a bit more specific and clear about it, not just...
I do think it would assist the inquiry and the Minister in answering the question if a bit more context was given.
I have
but
provided the entire context. I've asked her whether she's aware of the industrial relations guideline in relation to procurement policy.
Okay, well, I'm mindful of the resolution. That we've got to treat our witnesses with courtesy at all times, and so the Minister is attempting to answer, and so we should afford her the time to provide an answer.
Mr. Tudor-Hope, the New South Wales Industrial Relations Guidelines, Building and Construction Procurement, have been enforced since 1 July, since you were in government. The guidelines apply to building and construction companies that bid or tender for New South Wales government infrastructure and are administered contractually by client agencies. The guidelines support outcomes associated with compliance with the law, productivity, safety and freedom of association. And a tenderer must provide a workplace relations management plan where the government department or public sector body contribution
Thank you.
to a project.
Minister, you have now had an opportunity of refreshing your memory in relation to those guidelines. Is it true that you, in fact, have put those guidelines on hold?
I will get the exact information for you before the end of the hearing.
Thank you very much.
Okay, just so we're all on the same page.
No,
Okay.
and I accept that.
Okay.
Do you have any concerns in relation to the impact of industrial relations guidelines in respect of procurement policy, in respect of the CFMEU's efforts to enforce a no-ticket, no-start approach to construction sites?
Point of order, Chair.
A point of order has been taken.
I think the Minister has already indicated that on the specifics of the procurement construction policy that she will come back with relevant information for Mr. Tudor-Hope.
I won't uphold the point of order. Mr. Tudor-Hope
Thank
has introduced a different element to the line of questioning, so I won't uphold the point of order at the moment. Mr. Tudor-Hope, or sorry, Minister, you...
Yeah. So, with respect to your... sorry, can you...
So do you have
ask
any
me-
concerns about the CFMEU's efforts to enforce a no-ticket, no-start approach on construction sites in New South Wales?
I'm not aware... as the Minister for Industrial Relations, to the best of my knowledge, this matter has not been brought to my attention. And I'm happy to take
The Master
that.
Builders Association has not put that issue in front of you?
I'm happy. I've had, and through my diaries, as you can see, I'm sure, I have many meetings. I've had many meetings with industry, with families, with injured workers, with a whole range of
people. Did the Master Builders Association put that issue to you?
They range a whole... They put to me a whole range of issues.
Was that one of them?
That I take into
Mr.
consideration.
Tudor-Hope, it doesn't facilitate the productive inquiry if you're interrupting the Minister in the course of her answer. So can you please allow... I know that you've got short time, but please allow the Minister to provide a reasonable
But that
answer.
should not be unlimited, Mr. Chair.
It's not I understand that. It's not unlimited, but the Minister's answer's been going for about 25 seconds. So, Minister, you have the call. Please continue.
Thank you, Mr. Chair. And Mr. Tudor-Hope, I meet with many stakeholders from industry, from
Can I just redirect you,
families
Minister? I
and-
asked you a specific question about the Master Builders Association.
Mr. Tudor-Hope, there are many issues. As you know, you were a minister 7 months ago, and you know every single day a whole range of issues are brought to your attention. I will take what you're saying on board, and I will come back to you. But
Thank you.
a whole
Thank you.
range of issues are brought to me as a minister.
Thank you.
And I want to make sure that I provide the correct and considered advice.
So when you in fact attended on the Industrial Relations Minister's briefing in respect of the tranche of IR reforms known as the loopholes legislation, did you in fact make any representations of the concerns in respect of stakeholders in New South Wales to that legislation?
Mr. Tudor-Hope, are you asking me to divulge my what I've said to the federal government with respect to that meeting? Is that what you're asking me?
I'm asking whether you made any representations in respect of the stakeholders or industry stakeholders in New South Wales about concerns in respect of that legislation.
Mr. Tudor-Hope, I, along with all the ministers from the states and territories, attended this meeting with the federal minister with respect to this bill, and we spoke about a whole range of issues. And as you know, a communique has come out about that, and many of the industry and stakeholders and unions have put forward their concerns and their issues to the federal government via their representations with respect to the issues that they have concerns about.
No,
And so my role, as you know, you held this role, and you've
Minister.
been in those meetings, Mr. Tudor-Hope, and you, I don't have to tell you, you've been around for a very long time.
That's the reason I'm asking the questions, Minister.
But you know, Minister Tudor-Hope, you've been in those meetings, and you know very much so how the process works. And you, as a minister, of course, will ask questions and will put forward the views of your state. And
So do you agree with me that there are 2.5 million small businesses in New South Wales?
if that's the figure that you're putting to me.
So 2.5 million businesses in Australia. I think it's
Small-
800,000 businesses, small businesses in New South
businesses
Wales.
in New South Wales. I don't. I'm
Are you
not-
concerned about the impact of that legislation on small business in New South Wales?
I support small business.
Well,
and
are you
what-
concerned about the impact of that
Point of
legislation?
order.
What I did, Mr. Tudor.
Point of order, Mr. Namber.
Perhaps the Minister could be given the latitude to answer the question in accordance with the procedural fairness resolution.
Yes, I uphold the point of order. It's important to allow the Minister to answer and provide an answer with some context. If you could allow the Minister to answer, Mr. Tudor-Hope, that would be greatly appreciated by the committee.
Mr. Tudor-Hope, one of the first things that I did after I was sworn into this very important role was because your government left us with a big mess with respect to premiums, and what I did was support small business by making sure that they didn't cop 22% insurance
Well, so did I,
premiums,
Minister.
right?
So did I.
So, no, but what you did, I mean, you guys, anyway,
Thank you, Minister.
I'll come back to that issue, by the way.
sure, good luck to you.
Mr. Borzak,
No worries.
we have 10 minutes of questions from
Thank you,
Mr. Borzak.
Thank you, Mr. Buckingham. Welcome, Minister. Good to see you there.
Good morning, Mr. Borzak, and it's great to see you.
Just, I suppose, going to the heart of one of the key areas of your responsibility as a minister, and that is eye care. I'm sure we all care about eye care, given that it's the workers' compensation organisation, vehicle, structure, whatever you like, that supports not only small business but all business in New South Wales. What's actually been going on, for example, in eye care in the area of return to work rates? If I go through, which I have been doing, and looking at what was going on since 2017 and the procession of workers coming through my office complaining about iCare. What has your government done to improve the return to work rates and the treatment of workers in that space?
Mr. Borzak, it's a very important question, and I know that yourself and Mr. Banasiak and your party very much care about this issue, and you have been advocating for a very long time, and even when I served with you in the upper house, you're a very strong advocate for working people and for fairness, particularly those people who are injured at work. Mr. Borzak, as you know, that for years we watched the former government, they trashed injured workers. They brought in the terrible workers' compensation changes in 2012, and it devastated a lot of people. We saw what happened previously in terms of appointing unqualified people, dubious procurement practices, and you know we've heard all of that, and my very good colleague, the Treasurer, ventilated those issues over a period of years, and we saw that the McDougall review exposed a lot of these issues. And what we committed to, and I know that there's been, since McDougall, and there's been a change of management and a change, and there is those recommendations are being implemented and worked through. One of the things that, our key mandates was putting injured workers at the centre of care. And like yourself and like all of you and the opposition as well, all of us have spoken to injured workers and their heartache of going through a bureaucratic process. And I think one thing that I can acknowledge is that having both responsibility for safe work and for iCare means that we can bring the organisations together to work in a collaborative way, so we get the preventative piece done really, really well and get out there and work with our industry stakeholders, our business, provide them support, and when we get to the point of where people are injured, where we provide wraparound support, urgent support, and one of the things that we have done is ensure that the injured worker is at the centre of care. I think that's something that we're all very keen to ensure that injured workers don't go through the rigmarole of having to speak to different case managers and different claims agents. And these are the stories that we've all heard, all of us, regardless of party. I get a lot of representations, and I'm sure former government ministers as well got the same inquiries about the process and one of our election commitments was reforming that process and making it better and simpler and putting injured workers at the centre of care. And one of those things is improving the standards around claims managers. I think that's really important. When you get injured, I mean, we know the stats, that within the first 4 weeks, we need to make sure that we look after people. So we get them the services they require. We've got that key person that's helping, that's supporting them. That changes, that process changes people's lives. And it means that having that care will help support them going forward. While I acknowledge there has been some improvement, of course, we have much more to do. We were left with a lot of challenges, and we're working very closely, collaboratively, and I'm very, in a very positive way, and I had a message from a family whose son died at work last year. The family are from the UK, and I received an email. I don't want to disclose the details of the family, but they were heartened with the process they went through under the former government and the process with our government, and they were very pleased to hear And I acknowledge that we have some very good people in Safe Work New South Wales who are the family liaison people who are supporting grieving families, which is really, really important, particularly where they've lost their family members, the breadwinner, or they've lost their sons or daughters at a workplace accident, that the people are already grieving and they're in a process of mourning and bereavement. And to have the sort of bureaucracy go to this section and go to that section, and I've had many conversations with our agencies about that. We've got to get that right, and we've got to have a coordinated approach. Sorry, Mr. Borzak.
That's okay, Minister. Just in relation to that last point you make about individuals,
Yeah.
Your government's been advocating for better stakeholder representation on iCare board. Would you also support union coalface union members actually being on the board as opposed to just union executives?
Mr. Borzak, and I acknowledge your question, and as you know, a bill passed a few months ago where after a lot of advocacy from injured workers and industry, in fact, and small business industry stakeholders, where we will now have representative of the unions and employer on the iCare
But
board.
I'm specifically talking
With
about
respect
individual
to-
members of unions,
We-
especially those that have been through the process.
Yeah, we are currently, that's a very good question, and we are currently undertaking that work in establishing a consultative task force where that group, made up of injured workers and their families, will speak directly to our iCare executives. And I just wanted to get to the point that I made earlier, that we have some very good people in Safe Work New South Wales who are the family liaison, who keep families up to date, the families who've lost loved ones. But what was really heartening for me to hear was that just last week, it might have been longer, Mr. Harding will correct me, but we had injured workers and families of the bereaved who spoke to iCare executives. So that's a really important dialogue.
Thank you, Minister. Well, Mr. Harding, maybe you can elucidate a little bit more in relation to how the board is going to be informed about the condition and treatment of injured workers around what the Minister was talking about. How is it going to be better? How is the board going to be better informed?
Mr. Borzak, just to be clear, your question is about how the board's informed in respect to return to work?
Yeah, my last question to the Minister was, is she looking at putting ordinary members of unions onto the board? She's talking in terms of committee's recommendations coming from the lived experience, I suppose, of various people who've been workers injured in the past and their families. How is that going to feed into the board so that the board can start making informed decisions?
Thank you for the question, Mr. Borzak. So, absolutely, we have regular reporting that goes to the board in respect to a large array of different measures with respect to impacts on injured workers and the way that we deliver services to them. At a macro level, we do over 75,000 customer satisfaction surveys with injured workers throughout their claims process. And that is, if you like, the baseline and the sort of underpinning base case for us understanding what that experience is and how we can improve it. And that gives us very good insights. We moved from an old model when I arrived, which was an NPS model, which, if you know about NPS, it's about advocacy rather than about satisfaction, which is about the key drivers of what actually improves outcomes. So how did we communicate with people? Did we get things on time? So timeliness of change and so forth, as well as then actual outcomes. So satisfaction is a key measure. We then have, as the Minister's pointed out, a number of other listening posts, if you like, where we're talking to injured workers of different types. The former head of the Workers' Compensation Scheme and I attended the Injured Worker Campaign Network about 12 months ago, and the new head of the Workers' Compensation Scheme and his team, as the Minister just mentioned, recently did some work with them in conjunction with the fatalities group that the Safe Work team run. So we are out there listening. We get a lot of representation, obviously, as the Minister has said. All of that information does flow to the board to enable them to understand what we're doing. To perhaps direct the question back to your earlier question about return to work, we have a number of initiatives driving a return to work. Again, they sort of come from a macro level discussion around the change to the claims model that we've been making for the last 2 years, which is really about removing the dependence on a single provider and moving to multi-providers, creating a competitive environment where those claims agents are driven to actually deliver outcomes.
So that's interesting. How many providers have you got now?
We now have 6 providers in total, covering across the scheme, and the dependence on the single provider that has been there prior to 2021 is now significantly reducing. Big part of that program, Mr. Borzak, is also the point that the Minister made about professional standards for case managers. Now, I think the DOR report that was part of the McDougall review, and it all sort of stimulated the McDougall review, which was undertaken by CIRA in 2020, highlighted the fundamental issue of the nature of capability of case managers. The individual who an injured worker is working with is so critical in their ability to return to work. And our professional standards are all about how we seek to drive a level of professionalism in that industry and move it away from being just something that people do. You know, in the 2017, you mentioned that era, people were recruited out of retail into case management, which is a significantly different role. We're now talking about professionalising that so that there is a clear pathway for people that have a qualification process that they can work with. We're working with a Personal Injury Education Foundation to build that as a qualification, and really driving our agents to invest in their people so that the interaction that injured workers have is much better.
Okay.
That's combined with funding to reduce caseloads so that those case managers are not being required and being overworked, but they actually have time to spend with injured workers. And one of the things that we're in conversation with is about how do we change their job. There's a lot of prescription and a lot of complexity from a legislative and regulatory framework in the way that the scheme works, and we need to free those frontline people up to be able to actually work with injured workers rather than feel that their job is ticking a whole lot of compliance boxes.
All right.
So there's a lot of activity. I could go on if you like, but
one of my favourite, can I just add to one of my one of my favourite things, and I think everybody knows this, is I love my mobile officers and my local engagement officers. So it's one of the things that I've been encouraging iCare to work with our local Chamber of Commerce and to get out there on the ground in the shopping centres with our officials, talking to small businesses on the ground in the shopping centres and advising them about their issues around premiums, incentives, and also making sure that we have our officials out there on sites. It's really critical that we bring government to the people, and that is why we were elected.
Thank you,
Thank you.
Minister Cotsis and Mr Harding, for that comprehensive answer. Minister, in 2018, the New South Wales presumptive cancer legislation was passed to provide eligible firefighters with access to workers' compensation for 12 specified primary and work-related cancers. In 2022, the International Agency for Research on Cancer, IARC, published a report which classified firefighting as a cancer-causing profession and noted firefighting cancer exposure beyond the 12 specified primary cancers currently covered in New South Wales. In other states, they are expanding the numbers of cancers that are covered by the legislation. When will the Minns government begin to provide New South Wales firefighters with the additional coverage that they're requesting in line with moves in other states?
Yeah. Thank you. Thank you, Mr Buckingham, and thank you, Chair. And I know that you and all of us, again, I think we're on a unity ticket here, and you're absolutely right that this has been out there since 2018, and I have had representations with respect to presumptive cancers for firefighters, and we want to make sure that we get this right, and our commitment at the last election was to examine improving benefits for our very hard-working firefighters, and I know that all of us here acknowledge their hard work over, particularly over the last few months, but in the coming months ahead, I know that for all of us, we wish them well and courage, and we thank them for their work in saving people's lives, saving property, and we will do everything that we can. We want to do, and we are examining improving those benefits for firefighters in relation to PTSD claims as well, and examining impairment payments for firefighters. So we are looking at those things, and the work has begun, and we will be able to comment more fully in coming months.
So, Minister, how are you looking at those expanding? Is there a formal process for that?
Yeah.
Who has carriage of that?
Yeah. So I've sought advice from iCare. We've sought options, and also I'll be working together with my colleagues about with my colleagues who have responsibility in this area as well. Minister Dibb, Minister Chandavong, the Treasurer, but in a coordinated, collaborative approach to make sure that we get this right, and of course speaking to the stakeholders. But once we have some of that formal information, I'm happy to come and brief all of you.
Okay, thank you, Minister. Minister, will the Minns government support a total ban on engineered stone?
Thank you, Mr. Buckingham, for that very, very important question. And I know that you have been a very, very strong advocate for a very long time. And as a former stonemason, I know that you and your colleagues mean a lot to me and to our government. And this silicosis is a deadly disease. It's a horrible disease. And since 2017, we have seen 1 in 4 people in this industry die, and it's a tragedy. What the Minns government has said is that after the Safe Work Australia report, I'm sure everybody has seen that report, one of the recommendations was a prohibition of engineered stone, and the government has made it clear, and the Premier has made it clear, that we support that. We support that option, that option from that report. I think it is a long time coming, but we need to make sure that we have a nationally consistent approach. I think that this stuff is, it's just devastating what it's done to people. And I know that yourself, and I know other colleagues on the committee as well, I know Mr. Rath and Ms. Boyd and my Labor colleagues as well, Mr. Tudorhope as well, all of us have sat in the Law and Justice Committee and have listened to evidence that's been brought forward by stonemasons and people who've worked in this industry. I know that working closely with Safe Work New South Wales as well in taking action from that point, but we want to see this. We want to see this happen, Mr. Buckingham.
When you say this, you mean a total ban?
The New South Wales government is committed with respect to that option, and I know that there is going to be another meeting before the end of the year with respect to all the other states and territories with the federal government. A number of states have put forward their views. We need to get this right. We have to get this right. and we have to do it ASAP. So I'm urging that we have a meeting with the states and territories as soon as possible, and we're very strong advocates. This is it's devastating what this has done to families, what it's doing. I have a number of people that work in this industry in my own electorate, and whether it's the installation places, whether many people who work in this industry are from non-English speaking background, and we know that in terms of many of them are contracting this at a very high rate. Now,
do you acknowledge, Minister, that some people may be being, while I acknowledge that the work is being done, but before a ban is in place, people are still being exposed in workplaces in this state and around the country?
Mr. Buckingham, we need to do something ASAP. There is work that is happening, and I'm happy to refer to Mr. Curtin about the work that we're doing in terms of safe work, and I know that iCare has also been doing some work in terms of screening as well. We committed, the Premier's committed to expanding screening. It's not just your ban. We've got a whole lot of issues here. We've got transition. We've got legacy issues here. We've got to look after the people now. So I'm happy to refer to...
Minister, I'll talk with... I've got the afternoon.
Okay, certainly.
And your response is a nice segue, because I appreciate the answer, because I get my CT scan results back tomorrow. So I'll find out tomorrow if I've got silicosis. In terms of those legacy issues, how are we going to make sure that some of those people who aren't actually stonemasons are working in labouring, construction, building, who in coming decades are not going to be exposed to these materials when they're removing them?
Yeah.
Should we not move to a national register of where the products are? Education, and making sure that the removal of this material is properly licensed, as we do with asbestos.
Yeah. You make a very important point, and this is why the next meeting with the Federal Minister, Mr. Burke, and the other ministers is going to be absolutely critical. And I hope all of you, including the opposition and crossbench and all, that we as a united state, and I'm hoping to find out what the opposition's position is on this matter, and I've had very good conversations with Mr. James, the opposition spokesperson, and but it'll be good to find out the position, because we want to go to the next meeting as soon as possible, put our position formally, get a transition plan, get that plan going across the states. We need to have a nationally consistent approach, so we don't have this stuff like asbestos going across the border, going round the back door. We don't want to have a lawyer's picnic, where what we saw with the late Bernie Banton, who was going up and down the courts, being dragged through the courts. Not only him, but many people that died of mesothelioma. We don't want to see, none of us want to see this. And so we will work very hard and diligently, and I know that when you speak to our agency heads, they'll be able to provide you with the advice about what we're doing now in having a coordinated process, because I absolutely agree with you that we've got a lot of people in our communities in southwest Sydney, Western Sydney, that need to be screened. We need to screen them. We need to look after these people, because there are too many family, particularly the breadwinners, who the families are losing these breadwinners. Families are losing particularly their fathers. So we need to do something about this. And you have my word, Mr. Buckingham, and to everyone on this committee, we are absolutely committed, and I'd like to know the position of the opposition as well. We go in there on a unity ticket. This should not be partisan. This is one New South Wales, and we go in strong.
Thank you, Minister. Well, my next question is to Mr. Tudorhope then.
Thank you.
No, sorry, Mr. Tudorhope.
You want to ask me a question?
No, I was going to. You're,
Go on, ask it.
You want the bipartisan position?
yeah, that's it.
Good.
So,
Thank-
Mr. Tudorhope, you've got 20 minutes.
Thank you, Chair. Just following up from the questions I was asking you previously, Minister, if it becomes more expensive to build, it's counterintuitive to be trying to increase housing supply if you're also increasing the cost.
Mr.
Do you agree with that?
So, Mr. Tudorhope, can I? So, just like, I don't want to. I want to be absolutely correct. You're asking me about the IR procurement guidelines. Is that
No. I just want if you just focus on my question. Do you
Okay.
just agree with the premise that if it is more expensive to build, it becomes counterproductive to a policy which says you want to increase housing supply?
But can I take you back?
No.
Can I take you back when you were in government, where you left, and mind you, there's a couple of big buildings in my electorate that your government oversaw, where people are having to go to court and NCAT and go back and forth under your watch. So if you want to tell me about structural issues with respect to buildings, okay, I can, after this meeting, we can go down and I will show you the disaster in my electorate with respect to structures and buildings.
Minister,
and if you want to talk to me about...
I've just asked you a specific
no,
question
but you're
about
you're
whether-
taking me down the merry-go-round, right, so you can make some
a-
political point. And I'm saying to you, if you want to
Minister,
talk about structural defects,
I'll redirect
I'll
you to a
take
new
you to
question.
structural
So,
defects.
Minister, just answer my questions. Do you, if in fact industrial relations reforms in fact increase the cost of delivering housing supply, will you be making those representations to the federal government on behalf of the building industry in this state?
So have you made those representations? So
I'm asking you, Minister.
No, but what's your point?
You attended on the industrial
minister's
relations
meeting,
ministers
an industrial
in respect of industrial relations
Industrial
reform.
relations meeting.
Do you accept that? The impact of those industrial relations reforms may in fact increase the cost of delivering housing?
May in fact.
So
do you have
made that
quantifiable analysis? May in fact. May in fact.
Well, have you asked
Well, I
Treasury
may
to do the
go-
modelling?
May go here, I may go there. I mean, what's may?
I'll ask Ms Campbell. Ms Campbell, have any
Come
modelling
after
been
April,
done in relation to the
before
industrial
June.
relations reforms on
Answer
the New South Wales economy?
What?
I'm not in a position to answer that question, Mr Tudorhope.
But you were in budget estimates with the Treasurer. Do you recall me asking the same question of the Treasury officials? Has any modelling been done?
And I believe we took that question on notice, Mr Tudorhope,
No.
so I would need to do the same.
And in fact, I think the answer that, to the best of the knowledge of the Treasury officials, no modelling had been done. So, Minister, do you accept that industrial relations reform may have, in fact, impacts on housing supply in New South Wales?
The federal government was elected on an industrial relations mandate. They were elected on a mandate. Is that what you're... They were elected on an industrial relations platform.
Minister,
and
you've
they're
agreed
currently...
with me. You've agreed with
I
me
haven't
that
agreed
housing
with-
supply is one of the issues.
Order,
Housing
Mr.
supply-
Order, Minister Tudorhope. Please allow the Minister to answer in full. The Minister is providing a relevant answer to your relevant question, so please allow her to answer before you interject. She was only a matter of seconds into her answer, so please afford the witness the courtesy that the resolution of the House demands.
Thank you. So, Minister, I'll move on. The Industrial Relations Task Force, when's that due to report?
It's just so interesting that you care about this issue that you did nothing about for 12 years. So, you know...
That's a simple question, Minister. When is the Industrial
Well, why
Relations
you-
Task
I
Force
mean,
due to report?
The task force has... the task force was established a few months ago, And as you know, former President Roger Boland and Anna Booth were commissioned to provide a report to the Cabinet. They were commissioned to provide a report to the Cabinet, and they have, as I'm sure you have the media release, and I'm sure that you have the scope and key considerations, and there was a lengthy considerations, because after 12 years of your government, where all you did was suppress wages, and
Minister,
this is why
these are questions about your
this is why we're fixing your mess.
Well,
you left us with a very big mess, and 12 years of wage suppression has meant that.
Well, you and I can disagree
we
on
have
that,
a
but
recruitment
the
and
terms of
retention
reference,
crisis.
Minister, the terms of reference suggest that the new industrial relations framework should be considerate of state finances while supporting efficient and effective service delivery.
That's correct.
Will an invitation to the Industrial Relations Commission to be considerate of state finances place any effective limit on public sector wages?
All of those things will be considered. This is advice to the Cabinet, and all of these things will be considered. We were elected on a mandate to remove the wages cap and to replace that with a new bargaining system.
I'll come to that.
I'm sure you will come to that, but we committed to this because there was no bargaining that was happening under your watch. There was no bargaining.
Yes, there was.
No, there wasn't.
Order.
No, there wasn't.
You are
There
wrong.
was a you 146C.
You are wrong.
146C.
You are wrong.
Regulation making power to suppress
Opportunities
wages.
for productivity enhancements.
There was no product. You tell me
Well,
the
no,
product.
I agree with that,
Mr.
Minister.
Tudorhope, you tell me the productivity. You tell me the productivity. I'll
ask you about the productivity.
I'll ask you about productivity because you know something that is really, and I think that you'll agree, because as the former member for Epping, and I know that you were a good representative of Epping. Actually, you should have stayed as the representative for Epping.
Yeah, well, okay.
Actually, maybe I've got a good idea. If the former Premier does depart, maybe you can go back and run for that seat.
This is irrelevant.
Sorry, I think the head office won't like me saying that.
Order.
But can I, Mr. Chair,
Minister,
Chair,
the budget papers
I-
already provide for employee costs as a share of total recurrent expenditure to rise from 41% in 2023-24 to 46.3% in 26-27. Does this figure already reflect the government's expectations for the impact of new industrial relations system, or will we see that reflected in not reflected in the budget until next year?
Mr. Tudorhope, the Treasurer took a lot of these questions and answered a lot of these questions with respect to these matters. I'm happy to let you know that the total employee-related expenses in the current financial year and in the final year of the forward estimates, 23-24, costed at $49.3 billion, inclusive of superannuation.
Thank you.
And that's
And I understand.
in
I understand
there.
that. I'm just
But also,
I'm just
when
trying
you're
to
talking
understand
about-
what the parameters are here,
But
Minister.
when you're talking about, what you're raising in your, and this was asked of me in question time by the Leader of the Opposition, you've got to remember that you didn't pay for the 1,100 nurses. You didn't pay for those, and so we're having to pay for those. And let me
Minister,
tell you about vacancies.
I'm just asking
There
you.
are vacancies.
I'm just asking you to confine yourself for the moment, just to understanding where the budget is going in relation to employee wage rises. And I understand we've heard ad nauseum in relation to the failures of the previous government, and you have a narrative in relation to that. Just let us understand what your understanding about the. In fact, the impact of the Industrial Relations Task Force will be. Has that been accounted for in the current budget figures, which estimate 4% increases over the period of the forward estimates?
Mr. Tudorhope, Mr. Mookie, you had Mr. Mookie here a week ago, and he's the Treasurer, and I'm working with him, like with all of my colleagues. We had to account for the nurses that you didn't pay for, and we are accounting for those employee-related expenses, including the salaries, wages, superannuation expenses, and employment on costs. And those are in the budget.
Yeah, I understand.
And we
that,
have
but
accounted for that.
But I just want to...
And also...
What are the threats to the budget going forward, though? Is one of the threats to the budget, and if you look at table on B6 on page B-5 of budget paper number 1, it provides this, that a 1% rise in employee expenses beyond the budgeted amount in each year would cost $453 million in 23-24 and $495.5 million in 26-27. If you have under budgeted by 1% for each of those 4 years, this would result in an accumulated additional cost of over $4.5 billion. Given that this exceeds the total amount of $3.6 billion in your Essential Services Fund, how will you cover those wage rises? Or is it covered in your bargaining parameters that they must limit themselves to the $3.6 billion which you've set aside?
Mr. Tudor-Hope, the Treasurer was here, and I refer you to the Treasurer's responses with respect to the budget. He's the Treasurer. My job is to set the framework and to ensure, if you want, I'll let you know that
the framework includes wage rises,
and
Minister.
I'm working, and we are working in a diligent and in considered and in a prudent, and we have stated this in the terms of reference with respect to the accounting of the state of the finances. I understand what you're getting here, but it is about ensuring that we are bargaining with the agencies, are bargaining with the unions, something that hasn't happened. And I'll let you know about productivity. I think something that I'm so proud of. And I know that the teachers and support staff in your former electorate in Epping would be very happy about this, that the policy of the Premier and the Deputy Premier about making 16,000 teachers and support staff permanent, that has changed their lives. That is real life.
Minister,
that is real life.
Minister, do you
that is what's
understand?
happening at kitchen tables today, where those people have permanent jobs. And you know what you did? You created an insecure...
Do you understand
no,
that
I understand. You don't understand.
The threat to the...
You were a threat.
Order, please, Minister,
to the
please.
public.
Order,
Sorry,
order,
Mr.
please,
Chair.
Minister and Mr. Tudor-Hope. It's very difficult for myself to keep up with the interjections and the back and forth, and must be incredibly difficult for Hansard. So if we could restrain ourselves to questions and answers and desist from interjecting, that would
Minister, I just ask you just to confine yourself to being... I understand that you want to run a political narrative. That's fine. But just for the purposes of this hearing, do you understand that one of the threats to the budget is wage rises above that amount which you have set aside for the Essential Services Fund?
That is what we've set aside. The Treasurer said has said that.
So the threat to the budget is if the wage rises exceed that fund.
There is a provision in the budget. The provision is there.
So if it exceeds that fund?
That is the provision.
So in fact that's the cap, is it?
That is
the
provision that the agencies,
Is that the cap?
the agencies and the unions will sit and negotiate and bargain, which is unlike your government.
So
you imposed a cap, and you created a recruitment and retention crisis.
Would you agree with me that you've created a new cap?
Massive vacancies.
Minister?
We have massive
You have created a new cap?
Order, Mr. Tudor-Hope, please, could you stop interjecting? The Minister is providing a relevant answer to your previous question, so please allow the Minister to answer without interruption, please.
Thank you,
Minister. The Minister is answering.
Mr. Tudor-Hope, can I tell you, I was the shadow minister back in 2011 when when you went to the election, you didn't even tell the people of New South Wales that you were going to impose a wages cap, and you brought it in. As soon as you got in, you didn't even measure the curtains. You got in here, you introduced this wages cap. And I
To the
said at
point
the
of order.
time,
Minister, a point of order has been taken. Mr. Tudor-Hope.
This is
your
not
point-
responsive to my question. This is my...
I want to take you back to the
Order.
history of this.
Minister, please, I'm ruling on it. I'm hearing a point of order. Mr.
This is not
Tudor-Hope.
responsive to the question that I was asking in relation to the threat to the budget being wage rises above $3.6 billion.
There is
She's
no-
answered. You've
Thank
asked
you.
about
Ms.
15
Tudor-
times.
Mr. Lawrence, you were going to make a contribution?
I would suggest that it is responsive to the point of order, if that is indeed a point of order, but I would have thought the question is more whether it's relevant to the question, and I would suggest that
It's not
it is
relevant.
relevant, and the Minister, of course, as we often hear from those opposite, is to be given wide latitude.
Yeah, I don't uphold the point of order. The Minister was being relevant to the question. Wide latitude is given, and the Minister was providing some very interesting context to the situation. So, Minister.
Mr. Tudor-Hope, I refer you to the Treasurer's response. You had him here last week. He said he would come back to you specifically on the numbers. In the coming year, we've increased public sector pay to 4.5, which is the highest wage rise that they have received in over 10 years. And one
Well,
of
not
the
when you
things-
compare it to the
one of
CPI,
the
though, is
things-
it?
one of the things
The
that
best
I
wage
said-
rises are
Mr.
under our
Tudor-Hope.
government, are they not?
Mr. Tudor-Hope, one of the things, and look, you're in government for 12 years. You had your policy. We were elected on a mandate to remove the wages cap and to
Minister.
sit down and to negotiate and to bargain and to be prudent, to be productive, efficient, and to make sure that we provide those
Thank you.
essential services to the people of New South Wales.
I'll take you back. I will
I'll
take you
take
back
you
to the-
back.
to-
I'll
to
take
the-
you back. Because back then, in 2011,
Well,
we
Chair, if you are
made
going
the
to allow the
statements.
Minister to flirt and play this
What?
sort of game,
Order.
What is
order.
that?
Order.
What a
to
ridiculous
flirt around the
Are you
to
taking
say.
the point of
He
order?
just said surely
Are
after
you-
this
Yes,
week
Chair.
he didn't mean to say that.
That was
surely.
to flirt around the question
What
in
are
this
you-
manner, to flirt around the question in this manner.
To what?
No, I did mean.
No, you
Order,
didn't.
order. I
That's a
don't know
very
what flirting
interesting
around
turn
the
of
question.
phrase.
I don't know what flirting around the question
Neither do I.
means, but
I
maybe
wanna-
Miss.
Well, it is an expression.
I call it
would have
dodging
thought.
it.
Yeah. Order. The minister was providing an answer.
I think
You may
Well,
not
you can
like
give her
the.
a-
You may not like the answer. You're at liberty to continue to ask other
Well, let me
questions
thank
when
you, and
the
I will.
minister has concluded. But interjecting
So
during
just-
the answer or interjecting generally is disorderly and doesn't help the conduct of the inquiry. The minister, have you concluded your answer?
Look, I just wanted to provide Mr. Tudor-Hope with some facts, and those facts are what the wage cap
Point
did
of order,
to...
this is not responsive to my question.
But I
To the
said
point.
I referred you to
a
the...
point of order has been taken. Mr. Tudor-Hope.
This is not responsive to my question. The question was in respect of increases above $3.6 billion.
That's not a point of order. Being responsive to the question is not
Well,
a point of order.
The minister should be
there's
responsive to the question.
Well, there's no being responsive to a question is not a point of order.
She can answer it any way she likes.
Yes.
It's got to be relevant.
It's relevant is the term.
Well, it's not
Ask Chris
relevant
about wide
to...
latitude.
Well, I
Why
don't uphold the point of order. I do believe that it's being generally relevant to the question. So, Minister.
I refer to the Treasurer's response, and
Thank
I
you.
just wanted to say to Mr. Tudor-Hope that we advised the government at the time, back in 2011, that by imposing this wages cap where you can't actually negotiate, that there would be labour shortages, and that's what's happened. And we have a recruitment and retention crisis. And so we've taken a policy to remove the wages cap and to bring forward a bargaining framework to ensure that we're investing in the labour shortages that's diminishing our capacity to provide the services that the people of New South
Thank you,
Wales
Minister.
expect.
I understand you've made that point
And-
on a number of occasions.
but-
Can I just say this, put this to you, Minister, that you've agreed with us today, that your bargaining parameters, including staying within the $3.6 billion essential services fund,
No, it's a provision. in the
services fund.
budget.
That's what you have told us today.
It's a provision.
So
It's
what
a-
you have, so if in fact there are wage
She didn't
increases,
say that at all.
I didn't
She
say
did.
that.
She didn't.
Order.
with
didn't
respect she did.
With respect, she didn't.
Order.
I didn't say that.
So-
I said
Dr.
that we're
Kane, please.
bargaining, that
Apologies, Chair.
So would you, would you agree with me that it becomes a threat to the budget in circumstances where the bargaining parameters would include increases above that amount which has been provided for in the Essential Services Fund?
Mr. Tudor-Hope, firstly, I don't agree with the premise of your question. And
Well,
secondly,
it's a threat to the budget identified in the budget
You've
papers.
had the Treasurer here, and the Treasurer has done a brilliant job, and the economics team have done a great job going through and providing an excellent budget, and we will all work within our means.
Thank you, Minister. Mr. Borzak.
Thank you, Mr. Buckingham. Minister, I just take you back, and I have got a bit of a fixation with iCare, I must say, because it is such an important part of supporting business, whether it's small business or all businesses in New South Wales. And I know, again, based on representations I've had in my office over a dozen years at least, from various people, complaining about the delays in their treatment programs, the implementation of those programs. And I also know by my reading that there is a program of improvement going on at iCare, but can you elucidate a little bit how that is actually happening? I mean, are we getting a better result statistically in terms of the treatment rates of injured workers?
Yeah, I agree with the premise that, and we have to continue to do better. And we were elected on a mandate to improve iCare, particularly with respect to the issues that you've raised about the treatment of injured workers, the response to injured workers, return to work. And return to work is absolutely critical. And this is one of the issues that we've been raising with iCare. And as Mr. Harding mentioned to you, that one of the things that they're doing is ensuring that they have the specialised claims managers, early intervention, working with safe work, professional standards framework. That's really critical, and that work is currently happening. In terms of the, you're absolutely right. And this is one thing that means a lot to me, is the way that injured workers are treated by any bureaucratic agency. They have to be treated with respect. They have to be provided with information that they need, and not be put through the mill. And so I've made my expectation very, very clear that we need to make sure that we get that right, that we're treating people as soon as that phone call comes through, as soon as that engagement is made, that we are responsive, and that we speak nicely, and we're kind and compassionate and professional. And I know that through this program, this improving the professional standards reform, I think that there has been, and I believe, some incremental change. And I have heard from injured workers who have said to me that there has been improvement. Of course, we have a long way to go, but we are on that path of improvement. And that is absolutely critical, particularly when people, and this is one thing that we've got to get this right as well. As soon as somebody's injured, let's get straight in there and let's get them treated. Let's get them the help that they need. Let's get them the support that they need, because as we all know, once people get past that 4 weeks and they start languishing, their mental health is affected, their family's affected, money's not coming in, they have to wait. And these are the things that are absolutely critical. And I think if we can get that piece right, and this is the work that we're doing, and we're working very closely with
Minister,
iCare on.
Mr.
Yes.
Harding talked before earlier about having now 6 service providers.
Yes, certainly.
How does that improve the scope of treatment?
Yeah, I think I think that's, I mean, I'm not going to comment on whether that's a better thing. I think, having a number of claims agents is probably the better way to go. But in terms of having that support to injured workers is very important. And I know that Mr. Harding, Mr. Farquharson as well, speaking to the agents, have made it very, very clear that is our number one priority, and that is looking after injured workers and making sure that their needs are at the centre of care. And this is, we took this to the election. We ran on this mandate about putting injured workers at the centre of care. And as speaking to injured workers who are on workers' comp for a very long time, the reality, we all know this, they don't want to be on workers' comp for a long time. They want, and talking to me, they want to feel purposeful. They want to be useful to society. They want to contribute back. I've heard many stories like you about some claims agents and the processes and the secondary injuries that people have had because of them not getting the treatment on time, and the disputes between the treating doctors and all. Like, we have to get this better. We've got to do better, and we've got to get this right. We've got to, and so I'm happy to refer to Mr. Harding to provide the further details.
Well, Mr. Harding, maybe you could tell us, drill down, how many how
we'll
many
get you the
people do you
stats.
actually have under management at the moment?
In total across the nominal insurer, or
Yep.
the total number of injured workers in the scheme? Bear with me, Mr. Borzak. Is around 62,350 in the nominal insurer.
Okay, 62,300. Okay.
But maybe perhaps to just enhance the Minister's response a bit. Yeah. So we are very focused on improving the approach to care for injured workers. The issue of delays, you asked the question about how does the claims model support that. Well, in the past, claims service providers were neither measured nor incentivised in respect to key quality, what we call quality measures in respect to the services being provided. Timeliness of the care that support is now a new measure that they're measured on and that they're incentivised on. Obviously, the scheme itself, from a legislative perspective, requires a treatment to qualify through the reasonably necessary characteristics that are provided in the legislation. That's a process that a case manager needs to be able to define if a particular treatment is reasonably necessary. In other schemes, there is a basis of reasonable and necessary, and there's quite a lot of legal precedent that flows around legal and necessary, reasonable and necessary. But reasonably necessary is a little bit different. It goes back to the conversation about professional standards and uplifting the capability of case managers, and I won't repeat that for the benefit of time. We have instituted a medical support panel, which is a panel of doctors that case managers can refer to and ask questions of in terms of understanding whether the treatment is suitable or not. And I can give you some responses. So CSP timeframes for decisions, and I've only got the recent timeframe, Mr. Borzak, from January of this year, but the timeframe for decisions is around about 4.7 days from a decision point of view. And any referrals, there's about 2,800 referrals have gone to that medical support panel this year in respect to, since the 1st of January. And the recommendation is that, again, the turnaround time 2.8 days. So we are conscious of the impacts of delays on injured workers, but there is an element here which is the underlying legislative framework that says we have to be comfortable that the treatments are reasonably necessary, and that's something to work on.
Well, that's obviously you've got an issue of managing risk.
Absolutely.
Yeah.
But so we are, and the Minister's mentioned that we're very consciously trying to bring injured workers into the centre of the care process, and that is something that we are doing not just through these professional standards, but also through the way we work with CSPs. We've rolled out a program called Fair Decision Making, which is about exactly what the Minister just talked about. How do we bring the injured worker into the centre of that decision-making process? I suppose the challenge we've got, as you can see, with the number of claims that are there and the complexity of the system that exists today from a legislative and regulatory framework point of view, that change by its nature will take time. We're changing people and behaviours, and we're changing practices that have existed for a long time. So we are trying to make progress. We are trying to improve outcomes and get people well faster. That's our whole goal.
Okay, my time's up.
Thank you, Mr. Borzak. Thank you, Mr. Harding. Ms. Boyd, you have 10 minutes.
Thank you very much, Chair. And good morning, Minister, and to all of you. I just want to come back to that issue on the on silicosis. I understand that at a press conference on the 26th of October, so the day before the joint meeting of Work Health and Safety Ministers in Canberra, the Premier was quoted as saying that New South Wales would be prepared to go it alone with a ban if a national meeting on that Friday was unable to reach consensus on a national ban. You also made comments around that time that New South Wales would go it alone if we couldn't get that agreement at that meeting. Why is it that we are now still waiting for some national agreement before we move ahead with a ban in New South Wales?
Yeah, look, and to your question, Ms. Boyd, and I know that you're a very strong advocate in this area, and I acknowledge that, and also both the Treasurer and, of course, Senator Shoebridge in their capacity on the Law and Justice Committee, and yourself have been very strong advocates for a very long time, so I acknowledge the work, but also with respect to the statement that was made by the Premier and myself, and that's right. However, we need to get this right at a national, we've got to get this right at a national level. And as I said earlier, we don't want to see this drag out like what happened with asbestos, and where you have the James Hardie in the 21st century doing what they did 10, 15 years ago. I'm urging all the other states, and I know that there are states and through the media who've also put forward their position, that we do need to have a nationally consistent approach. We need to work through the Safe Work Australia. Of course, as the largest state, we have our responsibility to
what
our
happened
people.
On the 27th then, at that meeting, were there other states and territories saying that they didn't support a complete ban?
That Miss Boyd too, I can't disclose the deliberations in that meeting. There was a communique that came out, and the decision was made to release that report to the public, and there were a number of items that we also talked about with respect to industrial manslaughter, and also the family advocacy of jurisdictions.
Sure.
So we talked about a number of issues. This was, of course, critical. This was critical
for a ban?
At
that meeting?
This meeting was to the recommendation was to release the report. That was the basis of that meeting.
Why did they sit on it for 2 months? Why wasn't it released in August?
Look, I'm not here to I'm not here to blame this state or that state, but look, it's been ventilated in the media, and the report was provided to all the state and territory ministers, and of course, we wanted it to be released. There was a holdout state, and I guess that's the process of the feds, where they respect the state's views. I understand that. I think that we need to get this right, and other states, we want to get this right, and so we need to make sure that when we go to the next meeting, that yes, we will be putting forward a position.
Yep.
And also, without again divulging the deliberations within the meeting,
Yep.
Of course we need a transition plan.
Okay,
and of
but can we
course-
just come back to respect, sorry, because I don't have much time, just with respect, when we look at the Safe Work Australia report, it is damning.
It is.
And is unequivocal in its recommendation that we ban.
Yeah.
So why was it not possible at that meeting to agree in principle a national ban with details to be worked out later?
Miss Boyd, I think that, again, I can only speak for New South Wales.
Yeah.
And so through that process, through the that Work Health and Safety Minister's process, as a New South Wales representative,
Yep.
I've without divulging the deliberations, we are a very strong state with
Yeah.
respect to
We
our
are
views.
a strong state, and we're an independent state that is able to go it alone should we wish. We're choosing to wait for a national ban.
No, look,
do you think that that is appropriate?
People are dying.
Exactly.
I know this. People are dying, and I know
Every day
this.
that we delay,
Yes,
more
I
people
agree.
will die.
And
why can't we ban in New South Wales today?
Because it is important. It is important that we get it right at a national level. We can't have a situation.
But we can get it right at a national level later.
We can get
We
it.
can ban it in New South Wales and protect New South Wales workers in the next sitting of
But
Parliament. You have the numbers in
very,
Parliament to do that,
yeah,
Minister.
But we are very. We've put forward our position. That report absolutely is damning and it's compelling, and there's no toxicological report or evidence or scientific evidence to say, any percentage is good. Engineer stone is bad. It's terrible. We've known this
in
and
New
we've
South Wales
had
for years.
and we've had report after report. And nothing was done
Yeah.
in New South Wales.
I know, but now we have a Labor government.
We are taking action, and we led the way. And the Premier has led the way. Our Premier has led
Why
the way.
won't you ban the use of engineered stone in New South Wales in the November sitting?
Because, Miss Boyd, I'm urging the federal government. This is a federal approach. We've got to take a federal and a nationally consistent approach.
You can do both,
And-
though. You can have a ban, and you can also be
But
working
you've got to
towards
go
a national
through.
approach.
But we, at the moment, what we've done is we've established a silica register.
Yeah.
We've got
I'm aware
got
of
an
that, but that's not
increase
a
in
ban.
compliance measures. I'm telling you what we're doing. We're increasing and expanding the screening
The
processes.
Safe Work Australia report says very clearly that no amount of safety checks or compliance improvements or anything is going to make a difference.
Yeah.
What we need is an urgent and immediate
hear what
ban
you're
to
saying.
stop people dying today.
I hear what you're saying.
If we
and
ban it today and even a small amount of the product goes across borders, we're still stopping this product exposing hundreds and hundreds of workers in New South Wales to this deadly disease. You have that power to do that this year. You have the numbers in Parliament. Why won't you ban it this year?
Miss Boyd, I hear what you're saying, but we need to have a nationally consistent approach. We are, and we
They're not
are
inconsistent.
working.
You can have a ban in New South
No, we
Wales
need
and
to have
set
a
the
consistent
standard and
approach.
also have a national approach.
I hear what you're saying. We need to have a consistent
The risk
approach
of us
with the
not
other
acting
states.
is higher than the unintended consequences that might flow through going before a national approach.
I've seen the devastation of what asbestos has done, and where workers working in dust-filled factories, particularly all the new migrants, and a couple of my uncles died from, these diseases because of, a whole lot of things that they, weren't provided. And I understand this. I get it. I understand this. But we have to do it through a nationally consistent approach. And I am urging the federal
Because on the
government to have
26th we were happy to go it alone. On the 27th...
if the states didn't come on board,
Yeah.
we are meeting again. We are meeting again very soon with the states. We
How
are
long
meeting
do
again
we give them?
with the states. I have urged the federal government, and along there's, And again, I don't want to put the blame on any particular, state or what have you. I think where we have a very collegiate approach with all the states and territories. I think we're all on one page. I'm not speaking out of school.
Yeah.
But we will have a meeting very soon to make a decision, to put forward. We're putting forward our position.
Yep.
And if, as we've said, if the other states don't come on, and I can certainly advise that there is a very strong mood for change.
Yeah.
We need to have a nationally consistent...
Just in interest of time, have you met with Caesar Stone or their lobbyist in the last 3 months?
I will... Can I get back to you? I have... I'll take that on notice, but my understanding is that my office, not myself, but let me get back to you on that. I'll get back to you on that before.
Can I just ask, Minister, before we conclude, will the New South Wales Government consider a ban on engineered stone if there's not a nationally agreed consensus after the next meeting?
Yes.
Great, thank you. In the absence of government questions, that concludes our questions for this morning's session. We have a 15-minute break.
Well, be half an hour.
Half an hour break. Hooray. 15 minutes has become half an hour. We will reconvene at 11:15. Thank you very much, everyone.
Thanks, Chair.
Thank you. Coming back, everyone. We will recommence, and we will recommence with 20 minutes of questions from the opposition. Mr. Tudor.
Thank you, Chair. Minister, were you involved in any of the negotiations relating to pay rises with the negotiated with the Teachers Federation?
Mr. Tudor, thank you for that question, and all my disclosures are in the public domain, and as I'm sure that the Minister for Education, Deputy Premier, has answered all those questions, and I did attend a number of, I think it was 2 meetings.
So the answer is yes, you attended 2 of the meetings?
Yeah.
The first range of offers included a wage rise of 10% for the first year and then 2.5% in every subsequent year. Are you aware of that offer having been made on behalf of the government?
Mr. Tudor-Hope, with all due respect, the announcements regarding the teachers have been made. The Deputy Premier has answered all those questions, and it's the first time in a long time that teachers will have this pay rise, very important pay rise.
Minister, I've got limited time. I asked you a specific question. Were you aware of that offer?
Mr. Tudor-Hope, my assistance with this, as you know this, you've been in this role.
I do know that.
And and as the former Employee Relations Minister, you know.
Minister, I'm inviting you to be responsive to the question. Were you involved in those negotiations?
I attended, as you know, in my diaries, I attended
and
2 meetings, and there are now thousands of teachers who have been provided with a pay rise.
Thank you.
And negotiations have...
there was a subsequent offer in respect of teachers where the wage rise, in fact, was 10% with no subsequent years of increases to 2.5%. Were you aware that that was, in fact, the final deal which was reached with the teachers?
Mr. Tudor-Hope, my support and assistance, as yours, with the work that you undertook in the work that you did as Employee Relations Minister. Let me go back. As you know, that the portfolio ministers, their agencies, in fact, have responsibility in terms of the negotiations, and what we have is a new classification structure which will see teachers jump from being among the worst paid to being among the best paid in the country,
Minister,
and will restore competitiveness.
Minister, would you? I have limited time.
I understand,
in relation to that. So there was a position which was first negotiated, and Mr. Gavrolatos, you may recall, rejected that offer, and then there was a subsequent offer, and you would be aware that did not include any 2.5% for the forward years, did it?
Mr. Tudor-Hope,
yes or no?
There will be ongoing discussions with the Education Department and Teachers Federation, and I refer you...
But there would have been bargaining parameters, would there not?
I refer you to...
Were there bargaining parameters in relation to those negotiations?
I refer to the Minister for Education's responses with respect to their negotiations, and there are currently negotiations that are at hand, and it's very important that there is that process. And I refer you to the Minister for Education's
you're the Minister
response.
for Industrial Relations, and you're responsible for setting the bargaining parameters, are you not?
As you know, with the ministers who are responsible, and my responsibility is to set the framework with respect to modernising the industrial relations system and having a
So
new
not to set bargaining parameters?
having a new bargaining system. Mr. Tudor-Hope, I refer you to the
You don't
Minister
know.
for Education's response.
Thank you. Minister, the Paramedics and Control Centre Officers State Award 2022 expired on the 30th of June 2023. When do you expect that award to be updated?
Mr. Tudor-Hope, as you know, that the Minister for Health, and he was asked a number of these questions at his estimates, and I understand that a lot of work has been undertaken, and between health and the HSU.
So you don't have a time frame at the moment, is that what you're telling me?
I refer you to
no, that's
Minister
fine.
for Health.
Do you expect the offers which are being made to the paramedics to be above 4.5%?
Mr. Tudor-Hope, I refer you to...
Point of order.
Order's been taken, Mr. Nambo.
Chair, this is budget estimates for industrial relations, not health or education or transport or whatever other areas of portfolio responsibility Mr. Tudor-Hope might want to inquire into. I think the Minister has adequately answered the question without being badgered.
Well, to the point of order, she is the Minister for Industrial Relations, and industrial relations is whole of government regarding the countless staff that the state government employs. So I think it's highly relevant to talk about public sector wages to the Minister for Industrial Relations across departments.
Yeah, I won't uphold the point of order. I do think it was a new question, and it is relevant to the administration of the Minister's responsibilities.
Yeah, look, and we all have a lot of respect for the paramedics, and they're dedicated and hardworking, and they're critical, essential. They provide essential services, and they're working very, very hard. Mr. Tudor-Hope and Mr. Rath, you know that there is continuing work with.
So do you expect
the
the offer to be made to the paramedics to be above 4.5%?
Mr. Tudor-Hope, that there are currently negotiations that are at hand with the relevant agency and the HSU, and the Minister for Health has answered those questions, and they've been and you know this as well.
Well,
that
Minister, I'll just move on to my next question. How often have you been to the Industrial Relations Commission in respect of applications relating to paramedics?
Beg your pardon?
How many times have you been to the Industrial Relations Commission in respect of applications the government is making in relation to paramedics?
As in me, individually?
The government.
Oh, the government, sorry. I'll...
You don't know? If you don't know, I can take it up with the...
Hang on. I can refer that to Ms. Dobbins.
I'll take it up with Mr. Houston.
Point of order.
A point of order's been taken.
It is entirely within order for a minister to seek that an officer elucidate on an answer or provide an answer to a particular question.
Yes, I uphold the point of order.
I'm happy.
The question has been asked. The Minister can refer it to one of the other witnesses for an answer.
Well, I don't require you to answer the question, Minister. I'll move on to my next question. Have you played any role in relation to being advised in respect of applications by the government to the Industrial Relations Commission?
With respect to disputes?
Yes.
At my...
Have you reviewed, for example, the application?
I have, I'm advised through our weekly meetings with respect to matters.
You don't review the applications which are being made?
Review the applications from the government? What, in what respect, though? What?
Well, the application which has been made, are you briefed on it and do you approve it? Is that a briefing
at
which
our
you receive?
meetings? At our meetings, I'm advised at what's on foot and what the matters are, and Matters are raised with me on a daily basis with respect to ongoing matters or ongoing dispute. I'm happy to refer
thank you for that.
further information to Ms. Robbins.
Minister, recent changes to the Crown Employees Fire and Rescue New South Wales Firefighting Staff Death and Disability Award have replaced health checks by a qualified independent occupational physician with health checks by a medical practitioner chosen by the firefighter. Did you have any involvement in relation to that change?
With respect to the firefighters?
Yes.
I understand that our agency, as you know, has been providing advice and assistance, and I'm happy to take that
On notice?
on
Okay,
notice.
thank you. Well, if in fact there was such a change made, would you have any concern in respect of occupational health risks not being identified in a timely manner to prevent occupational accidents?
I think that that's with respect to occupational hazards. Is that what
Yes.
you're alluding to? So what's the nub of the question? Like, what are you concerned? No, I do. I am aware, but what are you concerned about? Like, the award's been made.
We've moved from a specialist occupational health and safety check by a qualified occupational physician to a GP chosen by the worker involved.
Right.
You're not concerned by that move?
But if there are issues, my understanding is that the employee's GP will make a referral to a specialist. And can I take you back? This award expired under your watch, and what did you do? Nothing.
Well,
So
thank you.
we're cleaning
I'm
up.
asking what you're doing.
No, but I'm
So-
taking you back to the history,
Well,
and that's
the
the
history is irrelevant to my question.
Well,
in
no, it's
relation
not,
to the
because-
waterfall inquiry, of course, they were a waterfall disaster. These checks were in fact introduced with a 36-month trial of the new health checks for firefighters. Will it take a tragic accident to revert to safer procedures to put in place following the inquiry, where you actually require either trained drivers or, in fact, fire and rescue, firefighting and staff to be actually screened by qualified independent occupational physicians?
Mr. Tudor-Hope,
is that what
this matter was addressed by Minister Dibb at his hearing, and I refer you to his response.
Well, I want your response.
I'm referring you to
You're
his-
responsible for this
I'm referring
award?
you. Yeah,
You're
I'm
responsible
referring
for
you.
Point of order, Chair.
A point of order has been taken.
The Minister's answered the question and has referred Mr Tudor-Hope to Minister Dibb's response. So I think that's handled.
I don't uphold the point of order. The members asked another question, and they've moved on from that. So, Mr. Tudor-Hope.
So you've got nothing further to add about what your response is, in fact, to that award?
Minister Dibb answered that
You
specific
have responsibility
question.
for the award, Minister.
Minister Dibb answered that question. Actually, he answered that question, so I refer you and I take you to his statement.
Minister, there was a recent current affair program which identified a worker who was interviewed in respect of her experience in relating to eye care. Are you aware of that story?
Yes, I am.
And in fact, I think you made a statement in relation to the story, did you not?
I did, Mr. Tudor-Hope.
When did your office first become aware of the complaint by the lady identified in that program?
So, if I can take you back, that was a very distressing situation for Ms. Tran, and I'm very sympathetic, and these are the things that we don't want to continue happening. Absolutely not, and I know that we're on the same page here about this. My recollection was that our office received representations from Mr. Coure, and I responded to Mr. Coure. I can get you the date of that. I don't want to give you the wrong month, but I am very aware of that, the correspondence that was made on behalf of Ms. Tran by Mr. Coure. I responded, and Ms. Tran, and if I can paraphrase, that the response that I provided to Mr. Coure was the advice from iCare that Ms. Tran would be provided with provisional liability. I know that there's further advice that's been provided to Ms. Tran about that.
Well, Minister, I just, in your statement you said this, after I received correspondence about this case, I immediately made inquiries. Is that correct?
When we received correspondence?
Immediately, yes.
Correspondence.
You immediately made inquiries?
When we received the correspondence.
Well, what's immediately mean in your mind, Minister?
Well, when we receive correspondence...
Is 2 months immediately?
We tend to it...
Is 2 months immediately?
Point of order.
A point of order has been taken.
So the Minister was asked what is immediately in your mind. She'd uttered, as I recall it, 2 words before she was twice interrupted.
Yeah, I uphold. Yes, I uphold the point of order, Mr. Tudor Hope. Please allow the Minister to answer the question you have put.
I think it was just moving on with my question.
Well,
anyway.
Before you move on, you can at least afford the Minister the opportunity to answer and to say something.
Thank you, Chair. Mr. Tudor Hope, I'm happy to refer you to Mr. Harding, who's been dealing with this matter, and who has a history with respect to the officers who've been working
Minister,
on this matter.
I'm just wanting to know what the process was relating to your office.
And I've
you
question.
said in response to this program that you immediately made inquiries following receipt of correspondence. What I put to you, Minister, is you received correspondence 2 months before this program aired.
I wrote back. We received the correspondence, as you know, as a former minister, you receive a lot of correspondence, particularly when it comes to workers' compensation matters. You know that. You know that.
2 months prior, you received this correspondence,
and
in your response to the media, you said, "I immediately made inquiries with iCare." 2 months you received before you made
Mr. Tudor Hope,
before this program aired.
Mr. Tudor Hope,
you had that correspondence, Minister.
Mr. Tudor Hope, there is a process of correspondence that goes through an office, as you know, and it goes through the process, and that information was provided to iCare
2 months
for us
later.
to provide to get that information. Now, my understanding is during that period there was correspondence and there were officials speaking to Ms. Tran. When this was raised, when this was brought to my attention the other day, of course I immediately sought to seek further information to find out, because I do recall this situation, and I am, as I said, it is very distressing that somebody who is a parent of 2 small children, who's been in this situation. I'm very, I understand, I'm very sympathetic about this.
Thank you, Minister, and I accept that.
And
I accept that.
But
Minister, I just want to move on to, before I finish, another issue. In June of this year, you were quoted as making comments in relation to savings from reforms to reform the return to work policy. Do you have any policy changes in mind for return to work policy with iCare, and will you rule out the Victorian model of return to work policy changes relating to mental health conditions?
Yeah, and Mr. Tudor Hope, I know that you care about this issue, and I know that you made a statement at the International Day of Mourning about psychosocial claims and the rise in mental well-being in the workplace. So I know that you're not trying to score political points. I know that we all of us here care about this issue. We do have challenges. When you were the minister, me as the minister now, we do have challenges in both the public sector and in the private sector. And these are issues that are brought to me.
So what are the policy changes?
I'll let you know. I'll let you know. So I'll let you know. I've been talking about this in the Parliament, that I've sought advice from iCare to provide us with some options about a whole of government return to work. This is for our public servants, and to work with the Public Service Commissioner, to work with industrial relations. Once we have considered those options, happy to come and talk to you about this, because it is a whole of government approach. With respect to Victoria, I'm focused on New South Wales, and we've got to get this absolutely right. And you know this, we have a lot of people who are currently on workers' compensation in the public service, who are in education or in health or in other services, who do have capacity to work. So it's our responsibility. How can we help them manage and support them and provide a pathway? It might be retraining. It might be other support. So these are and everybody's individual. So we have to look at people individually. I know that Mr. Harding will have a lot more to say about this. And with respect to the private sector, I was speaking on a panel at a Business Sydney event a few weeks ago, and you know this is a big issue that's confronting industry, especially small business as well. And if you're a small operator, family operator, and how do we help support the small business operators where you've got people on workers' compensation because of psychological impacts? We have to do better, and I know that this is a real challenge for us. I think one of the things that I can say to you, and I'm not going to, again, score a political point, but I think that secure work in the public service is really, really important. And I think that you'll see a difference, particularly for those people who are support workers. 97% are women. We made the policy announcement, the Deputy Premier made the policy announcement to open up positions to make them permanent. And I know in your electorates and in ours, where you've got women who are working, it's mainly women who are working in these jobs, and for them having that secure position helps them as well in terms of their well-being and mental health. But I'm happy to ask Mr. Harding to provide further details about our okay.
I think I don't want to take my friend's time.
Sorry.
But I can take that up with Mr. Harding later.
I know that you care a lot about this issue.
Thank you, Minister. Thank you, Mr. Tudor. Mr. Borzak.
Thank you. I don't mind Mr. Tudor if he wants to ask some more questions. He's not getting very far on some of these things, but anyway. Can we turn your mind, Minister, to Safe Work New South Wales?
Certainly, Mr. Borzak.
Obviously, we know and understand the role is for Safe Work New South Wales is to basically give advice in relation to increasing the safety of workers in the workplace and their health, obviously, that comes from that. But I think in the past it's primarily operated in a bit of a vacuum, not so much so close to iCare as probably it should do. Is anything happening in that space?
Yes, it is, Mr. Borzak, and I can assure you that the agencies that I oversee as the portfolio minister know my expectation and the government's expectation that we want them to work in collaboration, and particularly where I am the first minister in a very long time to hold the position of Work Health and Safety Minister. So the Premier appointed me to this role. This is a very important role, and we take safety, all of us in this room, we all take safety very, very seriously. And in particular, we want to make sure that people go to work safely, they work in a safe environment and come home safely to their families. And that's really, really important to all of us. And what I've asked both Safe Work and iCare is to work in collaboration, and they are working in collaboration, and they have building very strong working relationships. And I'll give you an example. One of the things that one of the first meetings that I had with both the agencies was we've got a situation here where our wonderful Safe Work inspectors are out there and they're issuing notices, and they may be issuing a number of notices, prohibition, improvement notices, to maybe the same company or the same industry players, but iCare may not know about those prohibition notices. And what I've asked for is to share that information, so some of the cowboys who are doing the wrong thing are spoken to and looked at by iCare through a number of measures. I understand the privacy issues here, and this is a piece that both Safe Work and iCare are working on, but that is a really important collaboration where you've got PCBUs who are doing the right thing, but then those who are doing the wrong thing are continuing to just have the same conditions, So we want to make sure that that information sharing is happening, and you can ask both the agency heads in the afternoon. The other collaboration piece is around the psychosocial aspect, and Safe Work has got a really good team that they've established around supporting PCBUs. And a few months ago I was in the Hunter and attended a community service organisation about work design. So there was some issues around bullying and harassment. Safe Work was onto it, and they worked with the PCBU, with that community service provider, to make changes. And I know that iCare and Safe Work again are working together in this area. So that's a collaboration piece. But
maybe you can drill down into how does the collaboration reflect itself in better service from iCare, and perhaps even lower premiums.
This is something that we're definitely working on, and as you know, one of the first things that I did when I became the minister was to ensure that small businesses were taken into consideration with respect to premiums. One of the pieces that we're doing about premiums is also that outreach program. I was out in Blacktown last week with a number of my colleagues, where there were about 150 small businesses there. iCare was speaking. We had a number of stalls. iCare officials were speaking to the small businesses about how they can support their workers in a range of ways, but also how to also providing information about their premiums, incentives, different measures. So this is that contact, that one-on-one contact that's really, really important. I hope I'm answering your question with respect to drilling down, talking directly to small business operators.
I'm thinking in terms of interacting with Safe Work, and maybe someone else can add a little bit to it.
Sure, you can, Mr. Curtin.
Mr. Curtin?
Yeah.
Yeah, thanks, Mr. Borzak. I've been in this role for now 5 weeks, and I can assure you in that time the Minister's been really clear on her expectations that Safe Work will continue to work with iCare and CIRA really closely to make sure we're doing everything possible to reduce the premiums and to improve health and safety in workplaces all across New South Wales. Our team has a long history working with iCare and CIRA at a number of functional levels on specific programs, but also working at the executive level to make sure that we're pushing forward with any of those areas where we can improve sharing of data or sharing of research outcomes, or sharing a holistic approach to the work health and safety process, right from the prevention through the response process and injury management following workplace injuries. we work with iCare in a range of areas, particularly Mr Harding and I have had discussions in the previous weeks already in my time in the role to make sure that we're doing everything possible to move forward with those collaborations, but also to do everything possible to help injured workers and families of those that have deceased at work, to make sure that their experiences have been fed into the process in a holistic kind of way, rather than each agency looking at those individually, so that we can provide the best possible response for those organisations. And the same approach is happening with CIRA all the time. Our construction teams have also been out targeting businesses and looking at the workers' compensation requirements to make sure that they are not underinsured or lacking insurance for their workers, which is helping putting money back into the scheme so that there's a fairer approach for all workers and all businesses in New South Wales. So I'm very comfortable in this early stage in the time that I've spent with SafeWork that we're setting the foundations for me and for SafeWork as we move to a standalone agency to be highly collaborative with both iCare and CIRA.
Right. Yeah, well, I would have thought SafeWork and the close collaboration should ultimately, if it's working properly, result in lower injury rates and therefore hopefully lower premiums at the other end. Minister, is the iCare, and I know this is probably in the budget papers, but you might have some idea of it. Is iCare actually financially viable now?
With respect to iCare as a management of
in
the
other words,
schemes,
do insurance premiums actually cover the cost of doing business? Maybe Mr Harding can talk about that. I mean, I personally have seen a pretty steep increase in my workers' compensation bill in the last 12 months.
Thank you for the question, Mr Borzak. And I assume by iCare the colloquial reference is normally to the nominal insurer.
Yep.
Obviously there are 8 different schemes that we operate, and iCare is just the holding entity, if you like. In terms of the nominal insurer, yes, the nominal insurer is absolutely financially viable. You'll be aware, and we've given evidence in this forum over the last few years since I started, about the programs of work we have to try and rebuild financial sustainability, the significant hit to the funding ratios as a result of deteriorating return to work post 2017, and now we're in a state of recovery from that. That doesn't mean that the scheme isn't financially sustainable. Your question, though, is directly referable to premiums. Now, to rebuild that financial sustainability is largely a premium outcome. I mean, there's 4 key levers that we need to focus on to ensure the financial sustainability. Obviously, premiums are one of them. The work we talked earlier about claims and getting people back to work sooner is another. Our operating expenses is the third, and then the investment income that we derive from the portfolios. They're all 4 of them are the key drivers. In respect to premiums between 2014 and 2020 were held, I suppose, artificially low. There was 0 rate increases to premiums during that time. Just basic CPI inflation over that time accumulates to about 21%. So the increases that we requested of the Minister when earlier in the year really relate to the fact that that period of time where there had been 0 increases is a need for recovery for the scheme. The scheme's costs, about 30%, are generally driven by wages, the other 30% by medical costs. Medical costs generally have a higher inflation rate than the CPI, so you can see that the cost pressures in the scheme at a time when you keep premium rates at 0 increases just accumulates. So there is a period, and the Minister's provided direction that we keep that at 8% per annum for the next 3 years. So there will be further premium increases required to ensure long-term viability.
Is that an average 8% based on categories or all?
That's correct, an average of 8%.
Okay.
Absolutely correct. And perhaps, if you allow me to continue, I can elaborate on perhaps Mr Curtin's comments as well. The Minister mentioned that data coming from SafeWork about notices and other information. That's about making premiums fairer. And that will result in lower premiums for good employers who have safe work environments, employers who are proactively out there improving their work standards to ensure that those environments are safe for their workers. But it does mean higher premiums if you've got a track record of issues that safe workers are identifying, or that there is concerns that we need to take into account from an underwriting perspective. So there's a lot going on, I suppose, in that answer, but there's a lot of collaboration going. The scheme is viable. Premiums need to go up.
Okay, thank you.
Thank you. Just before I go to the Greens, I just wanted to ask one or two questions on this issue. Minister, if I go to my workplace and one of my colleagues at work hits me in the head deliberately, do you think that would be described as a safe workplace?
No.
No. What if they grab me and throw me to the ground and cause me to be concussed? Does that sound like a safe workplace?
That's assault. That's a criminal. That should go to the criminal jurisdiction.
What if I'm playing AFL? What if my workplace is a professional athlete?
Right.
So, does that sound like a safe workplace?
Well, I'm happy to refer that to our Mr. Curtin, but with respect to, if you're talking about sport and the sporting codes, I know that Minister Camper was here a couple of weeks ago. I'm not sure if those matters were raised with him, but I'll refer you to.
Well, I'll raise them with
Curtin.
the Curtin later, but the situation is that athletes, professional athletes, they have a workplace, do they not?
My understanding is that they have contractual obligations and they play part of the code. As contractors, but they're employees or they're contractors, but they have a workplace, and that workplace should be safe, should it not? All workplaces should be safe.
Are you sure that, especially in our modern football codes, hockey, and combat sports, those workplaces are safe when it comes to chronic brain injuries and CTE?
My preference is that I take this on notice and I provide further information and seek further advice. I'm not a medical expert. I know that there's a lot of work that's going on in this area, and I will take that on notice, and I'm happy to refer to Mr. Curtin.
I'll raise it. Are you aware that there's been a Senate inquiry into the epidemic, as been described, of CTE and chronic brain injuries across Australia, that's leading to incredibly adverse health outcomes for athletes, and including a spate of high-profile suicides? Are you aware of that?
Mr. Buckingham, I'm not, but no, I'm not.
Do you think you should be? That considering that the profile of the CTE issue, the terrible outcomes for those people in their workplaces, it should be an issue that the New South Wales government pay some attention to?
Of course, and I'm happy to, if you have a delegation of representatives that want to come and see me about this matter, I'm happy to talk to them and happy to have the experts. I'm happy to take that.
Okay, thank you, Minister. Ms. Boyd.
Thank you very much. Minister, I'm sure you have also been following the ETU's Nowhere to Go campaign over the last few years. They released an update recently saying that basically the shocking lack of women's toilets on building sites continues. We are facing a national sparky shortage. We have just 2% of Australia's electricians being women. I know there have been some moves to try and encourage more women into training, but if they can't go to the toilet once they're on site, they're not going to stick around. Will you commit to establishing mandatory minimum health and safety standards for workplace amenities in New South Wales?
Look, I'm happy to. I think that it's appalling that this still exists in the 21st century. I know that the ETU have been running a very important campaign with respect to amenities for females, and we know, and I'm not an expert in this, but there are health issues, there are long-term health issues for women in particular with respect to going to amenity. And so I absolutely will look at this. I'm happy to speak to yourself and the delegation, but this has been brought to my attention when I was in opposition. I was actually shocked that this is still an issue. The building sites that I have attended with Safe Work, and in fact we were at a building site a few weeks ago with the Shadow Minister as well, just down here at Martin Place, and there were amenities for everyone, and there are some very, very good workplaces that do the right thing, and absolutely, as you know, when you have clean amenities, clean lunchrooms, you know that those PCBUs are doing the right thing to help their employees. But with what you're saying, I'm not going to make a commitment in terms of mandatory. What I want to do is get all the information. I'm happy for us to do something about this, working with my colleagues, with a number of my colleagues about this matter, and also with Safe Work. But yeah, we need to do something.
Yeah, thank you, because the previous government had that view of let's wait for the industry to sort of sort things out, and it wasn't working.
No.
So yeah, that would be great.
Let's
Thank
do
you.
something.
I'm going to hop around a bit, but another big issue when it comes to, and I will have more questions for Safe Work this afternoon. But one of I'm getting a lot of people coming to my office concerned that the education and advisory function of Safe Work inspectors is interfering potentially with their integrity when it comes to regulation functions. And I know that this is something that South Australia looked at very carefully. In 2018, they had an ICAC report, and they decided that function really needed to be separated. And I'll give you an example. We have situations where, very helpfully, work sites are contacting inspectors for their advice in advance on how to deal with an issue. But then when that hasn't actually had the effect that they wanted it to have, and there's a potential breach, when they then contact Safe Work, the particular inspector feels a bit perhaps compromised because they were the one that gave them advice in the first place. So this seems to be quite common. Is that something that you'll be looking at doing in terms of dividing that inspectorate between the education advice function and the inspector regulatory function?
And I want to thank you for your question, Miss Boyd. And you know that for 18 months, when Mr. McDougall reported when he conducted the iCare review, one of the recommendations was that the minister responsible conduct a review into Safe Work. It took us 18 months to get the former government, and we pushed very hard through the media, SMH, through a whole range of campaigns, and I know that you were a very strong advocate that we needed to get this review. Mr. McDougall was appointed by the former minister in October of last year. He's currently conducting his work, and that work the report will be provided to us very soon. And the term of reference of going through all of those issues, and I think that we'll take a lead on his findings and the recommendations that he makes. I hear what you're saying. It has been brought to my attention when I was in opposition. We're a new government now. My expectation is that as an independent regulator, there's the Work Health and Safety Act. Inspectors have very important rules that they are obliged to follow, but also that they have, in terms of issuing notices, and they make their decisions based on what the rules are in the Act. I want to acknowledge our inspectors who do really important work. I've been out with them. I've done toolbox talks with them down at Bateman's Bay. They do really important
structural
work.
issue.
I hear what you say.
Yeah.
So, and Mr. Curtin will take that on board and in the
Thank you.
afternoon respond to you
in
about some of those changes.
The
as well.
final seconds I have
Certainly,
left.
certainly.
No, that's all right. A completely different issue. I just wanted to know, I know that the New South Wales government intervened in Conroy's small goods and the AMEU case on the side of the union, but the federal court decided in favour of the company and found that the casual employee's entitlement to long service leave under the current legislative framework was zero. In the context of that decision, and given that the New South Wales government had taken the side of the union, will you be taking action to secure the right to long service leave for casual workers in New South Wales?
Yeah, we've got a long-standing. I'm aware of this matter. I can refer it to Ms. Dobbins or Mr. Houston, but yes, our government now and our government previously has had a very long-standing commitment to long service leave for casuals as well. But in terms of the details, we'll get that. I can refer that to you, Mr. Houston.
I can answer that now. So that was a set of casual employees in New South Wales who are covered by the Long Service Leave Act are entitled to long service leave after a particular period. The issue in the Conroy small goods case was that the employees were also covered by a federal instrument. So the question was whether or not preserved entitlement that was amounted to zero under a federal instrument applied rather than what's provided for in the State Act. So that was the decision of the court, and that affects interpretation of industrial laws relating to long service leave in other jurisdictions as well.
Yeah.
So it's not a case that there is no entitlement to casuals in New South Wales. It was just in that particular case because of the preserved industrial arrangements.
But is there a way for us to tighten that loophole in New South Wales?
Well, it's the application of federal laws, so it's a matter that would have to be attended to by the Commonwealth.
Thank you.
Thank you, Mr. Houston, and thank you, Ms. Boyd. Mr. Tudhope.
Yes, Minister, recently you announced, this is reported on the 6th of November, that the Minns government has launched a sweeping review into iCare to identify where the embattled workers' compensation insurer can make cuts to excessive spending, waste and salary costs. You'll be aware, of course, that there was a very extensive review called the McDougall Review, which made significant recommendations in relation to the reform of iCare, and that those recommendations, or the carrying out of those recommendations, is reviewed on a regular basis by Promontory. What additional wages and cuts do you identify which need to be cut in relation to iCare over and above those things which have been identified by the McDougall Review?
Mr. Tudorhope, it's a bit rich for, as you know, like your predecessor, Mr. Perrottet, who set this up, and we've gone through all the issues, and they've been ventilated by the Treasurer, who has done an extraordinary job in exposing what your government did with respect to iCare previously. And of course, you were forced to, but you do admit that you guys let this go for about 6 years. Not only did you bring in a terrible,
Minister,
you made changes.
I direct you to this, is that the McDougall Review has taken place. My question specifically was, what additional things do you now identify over and above those things which are contained in the McDougall Review, which require the new inquiry or review which you have instituted?
Mr. Tudorhope, as you know, that there were, under your government, there were a lot of issues. You know that, McDougall, and then the Treasurer forced the former government to commission Justice McDougall to do the review. There were over Mr. McDougall and made a series of recommendations. Those recommendations are being implemented and continue to be implemented.
And monitored.
And we are, and there is a monitoring process, and we are getting updates. And what the new government has committed to, because we took to the election that we will ensure that injured workers are at the centre of care, but also that we will conduct the review, that we will ensure that there's an employer and an employee representative on the iCare board, which we have done.
We've agreed with all that, Minister. This is an announcement made by you this week.
That's right.
This week, which says
that's right.
that you've identified wages, salary and excessive spending. Can you please just identify what that is?
So now, after we passed the second bill a few weeks ago, where Treasury, which is a commitment that was made by the Treasurer and myself, that Treasury will have oversight of iCare, and which is great. However, announcing this operational review as part of our reform process, as part of an ongoing reform process, is absolutely critical to the work that we stated before we got elected as part of our election campaign, and coming into government, making sure that expenditure is spent prudently, and we have now passed legislation that Treasury will have oversight over iCare, and you should be commending us for doing this.
Mr. Harding, can I ask you this? Has iCare ever refused to provide material to Treasury if requested?
Not in my knowledge.
Thank you, Mr. Harding.
Minister, I'd like to turn back now to silicosis. You've committed to eventually banning manufactured stone. What transitional arrangements have you undertaken to support the industry in that ban?
Thank you, Mr. Rath, and I know that you're on the Law and Justice Committee, and you're also the chair of the Law and Justice Committee previously, and you've heard a lot of evidence. And I hear your question with respect to transitional processes for small businesses, consumers, and the legacy part. And I believe that through the national coordinated approach, we will have appropriate transitional measures to support the businesses, the suppliers, consumers, and of course the people who are working in this industry. So all those matters will be ventilated at the next meeting. But this is something that I've raised, and that we need to have concrete transitional processes.
And what measures have you been pushing with your transitional measures with your interstate colleagues?
Without, again, breaching confidence within that meeting, we will have more to say at the next meeting with respect to those transitional processes. And if you have representations from small businesses and other industry organisations, I'm happy to meet with them. But I want to make sure that we have a nationally coordinated process when it comes to transition. But more importantly, I would be very interested to know what your position will be with respect to the prohibition of engineered stone. I just want to know what the opposition's position is, if you've got one.
Well, we're here to ask you the questions, Minister. But has anything been done in terms of education, in terms of inspections, in terms of awareness for the industry to move towards banning manufactured stone. Obviously, it's a big change, and to get the industry fit for purpose with this change will require a lot of work. So, any specific measures that you can inform us of would be much appreciated.
I'm happy to provide. I'm happy to refer you to Mr. Curtin. If you wanted to, in terms of specifics.
We'll ask in the afternoon session more about that. I'll turn now to the licensing scheme. With introducing the licensing scheme and the register for at-risk sites, what's the timeline and what industries will be captured?
So with respect to, as you know, that we've, through legislation, we've established a silica register, but with respect to what did you raise? Licensing.
Yeah.
Yeah. So I'm happy to come back to you with respect to that, because we need, as I said, we need to speak to our state colleagues and the feds through a nationally consistent approach, and with respect to licensing and other matters, I'm happy to take that on notice.
And a register for at-risk sites as well, if you could, Minister.
We do have a list of sites where our inspectors visit, and we do have a proactive approach. My understanding is we have a proactive approach with respect to...
Are enough inspections taking place at the moment? I've heard stories about the number of inspections have decreased over recent years.
Recent years? You were in government 7 months ago.
Over the last 12 months.
In recent years, there were a lack of inspections under your government.
But what measures are you undertaking? Have those inspections increased? You've been in government for 7 months.
Mr.
Have the number of inspections increased in the last 7 months?
I'm absolutely committed. This is a deadly disease, and this is killing people, and I'm very, very strong on advising you and the committee members that we're doing everything we humanly can. This is asbestos Mark II, and we need to make sure that we are educating workers. We're getting out there into the workplaces, that they are complying, they are wearing their PPE, but we know that there is no level that is safe enough. Yes, the New South Wales government will support a prohibition of engineered stone, but you're absolutely right. You're still going to have people working in this industry. Most of them are non-English speaking background. Most of them are part of Sydney, and we need to get that education direct to them. And I know that our safe work inspectors are out there. Safe work, from the first meeting that I held, they know my view on this issue with respect to inspections, education, and more importantly is we have to get information to we've got to get multilingual information as well, because we know that there are, we know this, that there are people...
It's one of the law and justice recommendations.
You're 100% right, and I know that you as the chair oversaw those recommendations, and so I've asked Safe Work to work with Multicultural New South Wales, but again, you know this as well, we need to get the community organisations that are on the ground, so we need to get our non-government organisations that have those relationships with workers, whether it be through their faith groups, whether it be through their community volunteer, because they have the trust. And what concerns me is that we've got a lot of workers who also have a fear of authority and may not feel comfortable.
Yeah.
So where we have familiar, trusted community leaders that can take that message forward, and that we can support them as well going forward in terms of changing work, that's absolutely what I'll be doing.
Yeah.
And working with our agencies to do that.
Thank you, Minister. We'll probably have some more questions this afternoon for the officials as well. Minister, just turning now to, I've read that trade unionists are planning to block an Israeli shipping line from entering Australian ports, including here in Sydney. Do you support that action by the trade unionists?
The Premier made his statement very well known yesterday on the radio, and no. like I support what the Premier said.
You stand by the Premier's
I
comments?
I stand by the Premier.
Will you talk to any of these trade union officials to call off the industrial action?
Point of order.
A point of order has been taken. Mr. Lawrence.
Just struggling to understand how the position of the trade union movement on some issue of international relations and import-export could possibly bear on the task at hand, which is consideration of the budget estimates for the industrial relations portfolio.
To the point of order, the Minister is the Minister for Industrial Relations. This is
international
an
relations.
industrial relations issue with major economic implications to Australia. There's also, which I can lead to, a work health and safety aspect to this, which I'll come to in a moment. So I think it's highly relevant in the Minister's portfolio responsibilities.
Yeah, I won't uphold the point of order. I do think it is relevant to the Minister's responsibilities, and the question was asking what the Minister was doing in relation to the issue, so I won't uphold the point of order.
Minister, will you speak to the trade union officials to encourage them to call off this industrial action in light of potential work health and safety implications, not only economic implications of such industrial action?
Mr. Rath, as you know, in terms of the people have a right to assemble, and however, in a respectful way, and we've seen this over the last many weeks, the Premier has made his view known. I support what the Premier has said. I understand that whether the police have been advised, but I refer you to the Premier's statement.
Yeah, well, the Premier said, and I understand he'll have the right to assemble, but in his words, living in a free country doesn't mean that you can walk down to the port and stop lawful trade between Australia and its trading partners around the world. So whilst people have the right to assemble, wouldn't you agree that this is definitely a bridge too far?
I support what the Premier has said, and we have to take into consideration our trading obligations that we have, and I refer you to the Premier's statement.
Are you concerned about the risk to workers' safety at the port?
Am I concerned? That hasn't been raised with me. If you've got people who are concerned, I'm happy to take that.
Well, it's a fairly risky environment, I would assume, at these wharfs. When you've got industrial action by trade unionists, I would assume that there would be potential work health and safety risks that could be involved. And are you concerned about that, or have you looked into that?
But I'm sure that the law enforcement and all the processes with respect to assembly are all followed. But again, I take you back to the Premier's statement, and I stand by that.
If I could turn now to the safety of gig workers. Before the election, Labor promised at the election to establish discrete and enforceable codes of conduct for WHS work performed by on-demand platforms in the rideshare, food delivery, parcel delivery, and disability and home care sectors of the gig economy. What is the timeline of delivering on this commitment?
Mr. Rath, are you talking about the portable long service leave? Is that what you're talking about?
I'm quoting from your election.
But are you referring to the portable long service leave or the workers' comp? Because you've referred to the community service workers as well?
No, more about the enforceable work health and safety code for gig workers than the transferable.
Yes. Which is a very good policy that we're also introducing a portable long service leave scheme for community service workers, which means that they'll stay and provide service. This is a very important, so the gig economy is a priority area for the government, and we continue to conduct compliance activities to monitor the adoption of new work health and safety regulation requirements. With respect to our commitment that we made, as you know, again, the the Treasurer has been a very strong advocate, particularly with respect to gig workers. He was out there from the outset many years ago when you had gig workers, riders who were killed, and there was nothing there for their families, nothing there for their loved ones. And one of the election commitments that we made at the end of last year was to bring forward a workers' compensation scheme, and also to provide key entitlements. And we're currently working through that process, Mr. Rath, and I know that there's some...
What's the timeline of that workers' compensation rollout for gig workers?
I'm hoping, and without... I'd love this to have happened 5 years ago under your government, and we were advocating very strongly, because since then we've seen more riders who've unfortunately been killed, and I'm hoping in the first half of next year that we'll have a system. I want it as soon as possible, but we need to get this right. We need to ensure that we're talking to the industry, the union, community, that we're considering, and we're consulting, and we're doing wide consultation. I think that's, but we are in the process of providing, there's a number of options that we've asked iCare and CIRA. Did you want to say a few things about that, Mr. Harding?
Well, we can ask this
afternoon.
Okay. Yeah,
right.
So I also just want to turn to the regulations that commenced on the 1st of January regarding compliance operations for food delivery, in particular high-vis PPE and induction training,
Yeah.
the suite of measures that have been rolled out. Have there been any, or how many infringements have been detected? I know you might need to take that on notice.
I'll take that, yeah, I'll take that on notice, and yeah, I'll take that on notice, and you might be able to get that. Mr. Curtin can answer it very quickly.
Sure.
Or?
Yeah, in 2023, in relation to food delivery riders, we've issued 47 penalty notices.
47 this entire year.
47.
And I mean, these regulations that commenced, I mean, are they actually having an impact on the ground, or is it just window dressing?
Well, we want to see them working, and we're working on an education and awareness piece, and Mr. Curtin can definitely advise you about that.
Yeah, we are seeing an increase in compliance. The team's been out doing a number of blitzes through 2023. We blitzed January, we blitzed Newtown. In July, we've been out in Bondi, Haymarket, Darling Square, Stanmore. We're back in Bondi Junction in August, and again in September in Haymarket and Darling Square. You'll see the high-vis use by food delivery riders has increased significantly. I've seen that myself out in the community. We've been issuing notices. At times we issue notices to the food delivery riders where they're not wearing their appropriate PPE, but really particularly we've been focusing on the training requirements and the verification of training, and working with businesses to make sure that they are providing training to their food delivery riders. We've got a number of matters that are currently under investigation to potentially move through to prosecution in that sense.
Thank you.
Thank you, Mr. Curtin. Mr. Borzak.
Thank you, Mr. Buckingham. Minister, we've talked quite a lot this morning about iCare and support of injured workers generally, and the improvements in the processes around that.
Yeah.
Maybe you or Mr. Harding can maybe elucidate it a little bit for us in terms of what's actually happening in the bush. As you know, our party's got a abiding interest in what happens in workplaces, farms, especially, for example, in the bush. And what are you doing to support injured workers in the bush when they unfortunately are injured in their workplace?
Yeah. Mr. Borzak, that's a really important question, and I know that you have many constituents, you represent many constituents in the bush, and I know that farm safety and safety in general is very critical. I'll hand you over to Mr. Curtin or Mr. Harding, but I just wanted to let you know, I went down to the far south coast where one of the roads, Bateman's Bay Road, is being upgraded, and it was really interesting for me, and an eye-opener as well, where we have a number of construction workers, civil construction, on these projects who are from regional New South Wales, but they're travelling across. So because we've got a shortage of labour, you've got workers who are coming from whether it's Western New South Wales or far up the North Coast to do these jobs. And safety is absolutely critical. And I attended a toolbox talk in Bateman's Bay, in the Hunter, in the Illawarra, and absolutely we're doing some really important work with farmers as well. So I'm happy to hand it over to you, Mr. Curtin, and you can provide some more of the detail.
Yeah, thanks, Mr. Borzak. We obviously have teams spread out right across New South Wales. So we have just as strong a regional focus as we do a metropolitan focus. The team out regionally has been focusing on a number of particular agricultural sector workers over the last 6 months or so. We've been focusing on the far and mid-north coast, the central coast and the Riverina-Murray area. I know the team's been out in Ballina and Coffs Harbour working with berry and banana farms to work with them on work health and safety matters. We've been out in Port Macquarie working with wineries.
So just to drill down on that, you're saying you're working on work health and safety matters in these regional areas. What does that actually mean?
Well, that's both in the educative space and, if needed, in the compliance space. So undertaking our regular activities to make sure that workers and PCBUs...
Could you maybe talk a bit more into the mic?
Yeah, making sure that the PCBUs and workers are aware of their rights and responsibilities in relation to work health and safety. We often take an educative approach in the first instance, but where needed, officers may form an opinion to issue notices or undertake compliance activities depending on the information they receive during those compliance inspections.
Do you actually get into the detail of the processes of the work in terms of helping employers deal with how they might manage their workplace more safely?
Yeah, we spend a lot of time working with PCBUs that seek advice. They can call through to our call centre and we can provide advice in the first instance about how they can improve work health and safety. And we also offer the Speak Up app, where workers that might have concerns, that might want to raise concerns anonymously, can bring that concern to Safe Work, and we'll address that with the PCBU so that they also have an avenue to raise concerns.
Well, that actually, you raised it, and I was going to go there next, was that how is the treatment of whistleblowers now different to what it used to be in the past? I mean, whistleblowers were certainly not well treated in the past in relation to these matters. What's different now?
Yeah, I can't speak for the past so much as that I know that the Speak Up app that's been implemented by Safe Work has been very successful and given an opportunity and avenue for workers anywhere to raise concerns directly with Safe Work, and that can be done anonymously. And then Safe Work inspectors can use that information to provide advice to a PCBU or to attend and undertake compliance activities. So that's a very successful part of our information gathering process.
Thank you. Mr. Harding, what's iCare doing to support injured workers in the bush? You know, say for example, up the north coast or down the south coast or out in Burke. Pick that one for example.
Yeah, thank you, Mr. Borzak. Like Safe Work, we have operations spread across New South Wales. Our Newcastle team looks after the Hunter Valley and further west. Our team in Wollongong, similarly to the south. We have our mobile engagement team that similarly goes out and does work in the regional areas and spends quite a bit of time in the bush in respect to, we try and target specifically small businesses and, in collaboration with Safe Work, we're looking at how do we help educate employers about how they can create a safe work environment, but also if there is a claim, what do they need to do? How do they help their injured worker back to work? What are their obligations?
Well, for example, can a remote worker injured expect the same level of support from iCare as a metropolitan one would?
Absolutely.
But do they actually get it?
I mean, obviously the health system varies in regional areas, and a lot of their support will come from the health system. But in respect to our support, yes, it shouldn't be a great difference from the work they do with the case manager if you're here in Sydney versus up in the Hunter Valley or further out, you said Burke.
Well, yeah.
Access to health.
Do you have case workers actually living and breathing in Burke?
Not in Burke, no,
No,
Mr.
not in
Borzak,
Burke.
no.
So where would Burke be serviced from?
I think Burke is actually serviced from Newcastle.
From Newcastle.
But I can come back to you on that for your
That's a bit down the road.
confirmation. It is a bit down the road, yes.
Can you do better than that?
Well, as we talked about earlier, we need case managers who have, and we need case managers who can work together as a team. When they work together as a team, they can get better cross collaboration about how to help injured workers. But they are a specialised group of people, so it's not. We can't have them. We don't like to have them working remotely on their own, if that makes sense. So it is a trade-off. We try and make sure we have enough people represented regionally to get coverage as we can.
Okay. What's your turnover of case managers? I know under the old program where you had basically one case manager running the whole thing, which was always a fraught situation as far as I was concerned, certainly in past budget estimates. I didn't like the sound of it, but what's the turnover like now? I mean, I know you're talking about training more so now than ever before. Are you seeing an improvement in retention rates of case managers?
Absolutely, and that's been a key focus of our work with EML in particular, the primary claim service provider in New South Wales. So when I first started 2.5 years ago, the turnover rates were in excess of 30-40% for case managers. We did a lot of work investing with EML, and they have invested themselves in uplifting their retention activities, their investment in their staff to help build them. I'm happy to say that retention has come down significantly, almost well more than halved from that point. It is still higher than we would like it to be, and some of that at the moment is temporarily, where as we're bringing on these 6 new case claim service providers, we are in a sense generating a little bit of churn as people move around the industry, but we expect that to settle very quickly. So it is higher than we'd like to be, but that's, again, comes back to that focus on professional standards and creating career pathways for people, and creating a proper... all of the things we talked about before, Mr. Borzak, reducing caseloads, all of those things go to creating a job that people find attractive.
Just for a moment, how many actual case managers would you have employed amongst the claims management business companies that you have?
I will have to come back to you on that notice. I'm going to, if it's all right with you, I'll give you a round number of around 1,700.
1,700, okay. 1,700 managing how many cases do you think? Again, or just a round number.
Oh, well, I'm talking about the nominal insurer now. I mentioned before there's about 62.
That's the 62,000 figure you were talking about?
Yeah.
Okay. All right.
Can I just, Mr. Borzak, can I just interrupt your conversation with Mr. Harding, and with respect to having support or officials going out into...
Sorry, I can't quite hear you.
Sorry.
I'm an old shooter, I have to remember that.
Mr. Borzak, with respect to the matter that you raised earlier about our iCare officials going out to Burke and to Greater Western New South Wales, I'm happy to, and working with Mr. Harding, undertake to work in with yourself in terms of getting a team to come out to specific areas that you nominate, that we can come and help support, whether it's farmers or small business operators. But I'm making that invitation to yourself, and just to let you know, and also to committee members of all parties, that the last week of Parliament sitting, I think it's on the 20, somebody will remind me, but we will have a drop-in session for all members of Parliament, and we'll reach out to the opposition and the crossbench, but letting you know, as you're on this committee, that we will have an outreach drop-in centre where we will have iCare officials that specialise in a range of subject matters, and so we'll give you that information, so then the MPs can go back to their offices, or in your case your constituencies, and any matters that have been brought to your attention, whether it be about the nominal insurer, whether it be dust diseases, whether it be sporting injuries, CTP, any issues that your small business operators, please come forward. It will be, I think, 1:30 to 4:30.
22nd, Minister.
22nd, and we'll provide you with the room. I think it's level 8. And also, this is for everyone. So opposition, it's everyone. So I've had a number of conversations with some opposition MPs who've raised issues with me. And so just bring all your information, and hopefully we'll be able to assist. But I'll come to
All right.
your
Well,
office and
thank you for that.
we'll have some officials there.
Thank you,
Thanks
Minister.
very much, Minister.
Thank you, Mr. Borzak. Minister, do you believe that workers who are taking prescription medicines to treat a condition and who are safe to attend work unimpaired should be punished for taking the very medication that in many cases makes it possible for them to work and provide for their family?
Thank you, Mr. Buckingham, for your question, and I know that you're a very strong advocate, and I know that you represent thousands of constituents who are in this situation, and I know that somebody who has been through the torture of chemotherapy for a very long time, about 5 years ago, I understand the just going through that whole medical treatment, the effects, and I understand. So with respect to the issue that you're raising, the advice that I have, and I have Mr. Draper with me here, the head of our public service, who can elaborate further. But at the moment, there is no sector-wide policy on drug and alcohol testing in the workplace. Departments and agencies may have drug and alcohol policies and procedures specific to the nature of work performed by the workforce of the individual agency. Medicinal cannabis prescribed by a medical practitioner will generally be treated in the same manner as other prescribed medications under agency drug and alcohol policies. Medical advice may be sought where a prescribed medication could impair the employee's ability to perform the inherent requirement of their role and would be managed on a case-by-case basis. I hear what you're saying, and Mr. Draper, if you've got anything further to add.
Not a lot, Minister, but I agree with that comment. I think the main focus is really on impairment, like any other medication that someone might be taking. And I know you had a very constructive discussion with the Premier on that topic in this committee a week or two ago. So not much to add to that, really. I think it's a focus on impairment. I don't think there's any differentiation between different types. I think the discussion you had with the Premier was how impairment is measured, the methodology, and I think there's a bit of work to go on that.
Minister, just before I hand over to the Greens, would you consider supporting referring this issue of workplace drug testing and potential discrimination against those people taking medicinal cannabis? Would you support an inquiry through a select committee or a relevant committee? Do you think that's an issue that would be well exercised through that forum?
Mr. Buckingham, my preference is, rather than making a decision on the run, I hear what you're saying, and we have thousands of people in the New South Wales Public Service that we look after that are currently going through, harrowing cancer treatment and who have other matters, and I am listening and taking what you're saying on board. However, I have to seek expert advice and, of course, speak to our agency head and Mr. Draper, and also my colleagues, the Health Minister and other colleagues. And I think that it's happy to speak to you further about this matter. And I know that this is an issue that you ventilated very strongly. But my preference is not to make policy on the run, but to take advice in a very considered way.
Thank you, Minister. Ms. Boyd.
Thank you very much, Chair. In relation to the McDougall review for Safe Work, I understand we had an interim report delivered in May. What's the what's the completion date looking like for having that released in final form?
Thank you for that. Thank you for that, Miss Boyd. And we will have a report. Mr. Justice McDougall will be reporting hopefully by mid-December. So we'll have that report very shortly.
Thank you. In the interim report, there was discussion about excising Safe Work New South Wales from the Department of Customer Service, but there was a note that more needed to be done by way of inquiry before a recommendation could be made. Has the government received any recommendation or done any other work in relation to excising Safe Work New South Wales from DCS?
So there is, the work has been undertaken, and you know our position on this coming into the election, where when I was appointed the Shadow Minister for Work Health and Safety, it was an issue for us that you didn't really have, you had this better regulation unit that takes in fair trading, building compliance and safe work. I kind of wanted to, I kind of understand what the former government was trying to do, sort of have this one-stop shop, this one-stop regulatory shop. But in my view, it hasn't worked, and the evidence shows that it hasn't really worked. Some parts of it in terms of the coordination piece between fair trading inspectors and our safe work inspectors and building inspectors. But what we've been, what the Department of Customer Service has undertaken work because of our commitments with respect to building and fair trading, is that there has been an interim separation.
Okay.
We're waiting for the Mr. McDougall's report. Mr. Curtin can provide you with those details in terms of the separation, because I think that we, without preempting, you know, what Mr. McDougall's going to say about this separate, I think everyone's pretty much been saying we need a separate independent regulator. And we'll take Mr. McDougall's advice with respect to the recommendations that he
So we
makes.
have, so just before I go to Mr. Curtin,
certainly.
so on LinkedIn this month, actually, last month, Mr. Curtin indicated that he would be, quote, working with the Safe Work team during a period of major reform, including transitioning Safe Work New South Wales to again being a standalone work health and safety regulator for New South Wales, end quote, which sounds like the decision has been made. Has the decision been made?
The decision, the decision by the government. Let me go back. We made I think everyone understands that we need to have a standalone independent safety regulator. We all know that. Mr. McDougall has noted and made some assessment in that interim report of the 31st of May. The Department of Customer Service, in the process of changes within government agencies and their units, have been transitioning to excise, fair trading, building and safe work. And so that work is currently happening. It's a interim process at the moment until we receive Mr. McDougall's report.
I'll come back to that in the afternoon. I know that Labor made a commitment to reverse the onus of proof for PTSD claims for firefighters in the election for iCare claims. What's the status of that reform? Is that going to happen this year?
Can I get that? Take that on notice.
Thank you.
If we have something for you in the afternoon,
that would be great.
Yeah.
I note that in WA they've included that reverse onus for PTSD claims for paramedics as well, and I'm wondering whether there is any plans to do that for paramedics, nurses, and other frontline health workers.
I've had representations, and we did make a statement, but there is a lot of work that's being undertaken at the moment, and for the purposes of being correct, I want to make sure that we get that information to you.
Thank you. In relation to the devastating, it was the multiplex crane at the new
Yeah.
fish markets
Yes.
site. Given Multiplex was claiming on its website to be using innovative construction methodologies for the installation of those 3 cranes, what was the involvement of SafeWork prior to that accident occurring?
So, Miss Boyd, in terms of that final comment, I'll ask Mr. Curtin, and you can take that for the afternoon.
Yep.
But as we all know, 28th of September, a tower crane collapsed at the construction site. 1 worker sustained non-life-threatening injuries. The injured worker was not involved in works related to the crane. This is the advice that I have.
Mm-hmm.
And SafeWork New South Wales has commenced an investigation which remains ongoing. With respect
Okay.
to that question about Multiplex working in with SafeWork,
Yeah.
let's get that information for you.
Thank you.
Thank you, Minister. We just have a question from Dr. Kane.
Thank you, Chair. Thank you, Minister. Mr. Tudor-Hope earlier raised a question about the correspondence received in the Miss Tran case, and I think there was some toing and froing. I'm not sure that we got everything from you on that. Did you have anything to add?
Yeah, thank you, Dr. Kane, and thank you very much for your interest in injured workers. And I just wanted to provide additional advice to the committee that I received correspondence that was mentioned, and the same day made inquiries with iCare. Provisional liability was accepted, and iCare examined the final liability. I received no further correspondence about these issues. I was next made aware of the ongoing issues by Current Affair, and I immediately contacted iCare again. Final liability was accepted, and I've offered to meet Miss Tran and her legal representatives to discuss her experience. I think it's very important for us to understand step by step what's happened in this case and what we need to do, not to do better, that we don't do this again. Thank you. Thank you,
Thanks,
Doctor.
Thank you, Minister. Thank you, Dr. Kane. Well, thank you, Minister. That concludes the questions today, your part in this inquiry. So again, thank you very much for attending. We will now adjourn and we will reconvene at 2 p.m. Thank you very much.
Thank you, Mr. Chair, and thank you to all the committee members and, of course, the staff and our wonderful officials. Thank you.
Thanks, Minister.
Thanks, Minister.
You ready to go, Damien?
We've got some. Self-determined.
Stuff, exactly.
Well, thank you everyone
Quite a few.
for returning, especially to the witnesses. I appreciate that. We now have, we will recommence the questions and we'll begin with 20 minutes of questions from the opposition. Mr. Tudor-Hope.
Thank you very much,
You're ready.
Chair. And if I can start with the employee relations or industrial relations team, as you now are. And perhaps to you, Mr. Houston, how many applications...
Mr. Tudor-Hope, can you just speak in, bring the microphone down a bit closer?
How many applications are there currently before the Industrial Commission involving the New South Wales Government?
I don't have that number at hand, but I understand that there are normally about 300 odd disputes before the Industrial Relations Commission over a period of a year, the bulk of which I would expect to be public sector related.
I would expect that too, I must say. That in relation to those, how many of them involve applications in respect of proposed industrial action?
I'll have to take that on notice, Mr. Tudor-Hope.
In respect of actions previously taken, you'd be aware, of course, that there were circumstances where there have been fines which have been imposed upon industrial organisations or unions in connection with action which they have taken?
Yes, so the Commission has capacity to make orders to stop industrial action. If those orders are breached, there are avenues available to impose penalties for breaches of those orders.
And there are circumstances where penalties have been imposed, are there not?
Yes, that's correct.
Last year, of course, there were fines imposed against the Teachers' Federation. Is that right?
I would have to take that on notice. But there have been several in recent years.
And the nurses and midwives?
I would have to take that on notice.
Yeah. In respect of any fines which have been imposed, what is the current position in relation to collection of those fines?
The collection of those fines is not a matter that falls to the responsibility of industrial relations. My understanding is that the recovery of fines is a matter that's managed through, I think, Revenue New South Wales, but I'll have to confirm that.
Would you be able to provide me with figures in relation to fines which are outstanding and the status of those fines?
We don't have that information, but I can take that on notice and refer it to the appropriate government agency who does have that responsibility.
I thank you for that. You'd be aware, of course, that there was action taken in the federal court against the RTBU in respect of its unprotected industrial action relating to the turning off of opal machines. Do you recall that?
I think it was, if I recall correctly, it was the an application to stop the action or the threat of action, and that was before the Fair Work Commission.
And a component of that may have involved damages against the union?
I do recall that being a policy issue we were dealing with, yes.
What's the status of those proceedings?
I'm not aware of any proceedings being on foot.
So a settlement has been reached?
Point of order, Chair.
A point of order has been taken.
Mr. Tudor-Hope's asking questions about things that fall outside the jurisdiction of New South Wales Industrial Relations with regards to actions in the Fair Work Commission. So I ask that he stop that line of questioning.
I think that's a pretty... I don't think you could say that. I won't uphold the point of order. I think that you could say the industrial matters before the industrial relations...
That's federal.
Federal court?
Fair.
Taken by the government? New South Wales government?
Yeah.
Good, thank you.
I won't uphold the point of order at the moment.
So, have terms of settlement been reached?
I'm not aware of any settlement or proceedings.
So, in relation to those proceedings, to the best of your knowledge, are they still on foot?
Look, that would be a matter which would be managed through either one of the rail entities or through transport. So they would have carriage of that matter. So I would need to seek advice from them about the specifics of what you're referring to. It's not a matter which Industrial Relations has carriage of.
It's not in New South Wales.
Thank you. So, in respect of the proceedings which are currently on foot, relating to current industrial matters, do any of those matters involve applications for damages?
I'm not aware of any applications for damages which have been instituted through Industrial Relations at least. But I should say there are inevitably proceedings which are brought by other government agencies which we would not be involved in necessarily. But I can't think of anything.
Ms Dobbins, I now turn to you in relation to the bargaining parameters, which we briefly discussed on the last occasion, and we had a discussion about the manner in which bargaining parameters are potentially arrived at. Does the Senior Officials Wages Advisory Group still exist, or committee?
Yes, it does.
Still exist?
Yes, it does.
And in respect of that, what are the guidelines which apply to them?
So the governance process that was in place under the former government is exactly the same under this government. The SOAC, as we call it, committee still exists and meets to consider bargaining parameters or positions that may be put by agencies. That committee of senior officials can agree that those parameters are in line with a government decision or a cabinet decision. If they are not, we recommend that the relevant agency go to the ERC to get a sign-off.
So, in respect of the bargaining parameters for the Teachers Federation, did SOAC meet in relation to setting those bargaining parameters?
Meetings were held between Industrial Relations and Treasury, but ultimately it was a cabinet matter.
A cabinet matter or an ERC matter?
Sorry, an ERC matter.
So, and that issue was referred to ERC, was it?
It was considered by the ERC, yes.
And the decision in respect of the 10% wages increase for the Teachers Federation, was it the case that SOAC had in fact approved those bargaining parameters?
I'm not sure it's appropriate for me to get into the advice that SOAC provides to agencies or government, but certainly the process that was in place and is still in place under that Premier's memo still exists, and the role of SOAC still exists.
So, just enlighten us, in respect of the wages policy, and as my understanding is that SOAC, its chief task is to ensure that agencies are complying with the government's wages policy. In relation to the bargaining parameters which are approved by SOAC, do they take into account, I assume, the government's current wages budgeting bill or wages budgeting position?
So the current government's wages policy is a little different to the former government. So the wages policy at the moment is the 4% plus superannuation.
Yes.
And SOAC certainly takes that into consideration. For over the forward estimates and the future, the Industrial Relations Task Force is going to provide a report to government about what the bargaining system and approach will be in the future. So there's not a wages policy in the same sense that there was in the past. So SOAC's consideration is in relation to that existing announced policy of 4% plus superannuation.
Plus superannuation. And does it take into account issues like productivity outcomes?
For the first 12 months, that preliminary offer that was made by government, it is as described in the government's media release. What it will be in the future, I don't know yet.
Well, is there a guideline document as to what the government considers to be a productivity enhancement?
There is advice that we have worked with Treasury to develop and provided to agencies. I don't think I've got a copy with me, but yes, there is some guidance to agencies in relation
Are you able to provide
productivity.
us with a copy of that on notice?
Yes, I'll take that on notice.
Thank you. So the current position of the government in respect of its wages parameters is 4% plus superannuation.
That's correct.
Plus any productivity enhancements or outcomes which may be argued by the particular agency which is seeking, or public sector union which is seeking wage outcomes.
Yes, agreed and discussed by the parties, yes.
The previous government's position, of course, was a wage cap of 3% plus superannuation plus productivity outcomes. So it's a similar policy, just 1% improved. Is that right?
No, I wouldn't quite say that because it's not limited to 0.5%.
So not limited to, so an increase above 4% is unlimited?
It's there's not a cap, as you know, in the sense that there was before.
A regulation, yeah.
That's right. So the Cabinet can determine what improvements or productivity or interests have been offered by the parties to for them to consider whether to give the agency the authority to go ahead and make those offers.
But from SOAC's point of view, though, your position is 4% plus super plus productivity. Then it's a matter for Cabinet whether they approve other bargaining parameters. Is that right?
That's right.
So, and as you correctly outline, that is something which, in fact, could be unlimited.
I guess in the sense that there's no cap, it's unlimited. Whether the parties can come to an agreement on various service improvements or enhancements that could be made or productivity improvements that lead to employee-related savings, yes, there could be a whole myriad of things that they could agree to.
Yep. How many awards are there which affect the public sector?
Mr. Houston, do you have that number in front of you?
I think it's...
The last time I looked, it was about 111. Would that be about right?
114.
114 different awards. In relation to the negotiation or the updating of those awards, how many remain which have expired? How many are there that are expired which still remain to be concluded?
So we have 19 that are currently expired. And when I use the number of 114, they're the instruments which provide pay increases. So there will be other instruments which might apply to an employee that that don't provide a pay increase. So you might have a condition-specific type award. So the actual number that applies across the sector is a larger number. But the ones that we track is the 114.
114, and each of those contains agreements relating to potential pay increases.
Yes, I mean there are some cohorts that are included in that group that might be management type roles or people covered by SORT. There's still employee groups within the sector. But
on notice, can you provide me with a list of the 19 which still remain to be negotiated?
Yes.
And Ms Dobbins, are you able to provide on notice a list of currently where those negotiations are up to?
Yes, Mr. Tudor.
Did SOAC sign off on the 10% award to the Teachers Federation?
I can't recall. I'll have to take that on notice.
In relation to each of the awards which have been reached, has SOAC signed off on each of them?
I'll need to take that on notice also.
And have they set bargaining parameters in relation to each of them before they were concluded?
So, as you know, the SOAC doesn't set the bargaining parameters. That's a matter for the public sector employer.
Mr. Houston, there were a component of the work that you do involves long service leave awards, or the I suppose supervision of the Long Service Leave Act.
That's correct.
That's correct. Have there been any prosecutions which have been instituted in respect of failure to comply with the obligations under the Long Service Leave Act?
Yes.
How many of those are there?
There have been a number that have been concluded this year. The most significant of those was against the Mosaic brand and its subsidiary companies, and that involved, if you give me a moment, I think I did have details of that. So I might have to come back to that, but 8 was it, sorry. So that involved a underpayment of $293,000, and there was $88,000 in underpayments to various employees through coming out of those brands.
And there was an audit, I recall, which was being conducted in respect of the 4 major banks in relation to long service long service leave. Is that concluded?
I think there are some elements which are still ongoing. In at least one of those, it was impacted by the interpretation from that Conroy decision, which we spoke of earlier.
The team which you supervise, which looks after long service leave, how many are part of that team?
About 24.
Conducting the audits?
No, well, there are a couple of areas. So 24 includes those that provide support to complaints about non-compliance, but also educational activities. So that's the inspectorate function is about 24.
And is the case which you mentioned in relation to Mosaic, is that the only case where you are currently conducting any litigation in respect of?
The litigation has concluded for that matter.
Yep.
There may be still some other ones on foot, but I can provide details on notice if that would assist.
Thank you. In relation to the Annual Holidays Act, Ms Dobbins, have we approved any? It's really an ongoing process, is it not, in relation to the approval of local annual holidays?
So the Public Holidays Act is an area which falls within our responsibility.
Yep.
But there are, sad to say, no new holidays that I'm aware of.
No. We haven't instituted a coronation holiday or a...
No.
Not under this watch.
Not yet.
Probably May Day.
Is May Day a public holiday? But there are local holidays.
Bastille Day.
There are local annual holidays which are approved of in respect of various local government entities, are there not?
That's right. There are local, there's capacity to declare local public holidays and also local event days as well.
How many new local public holidays have been approved in the last 12 months?
I'll have to take that on notice.
If you would. And the particular local government authority which has sought the approval of those local holidays?
Yes.
Ms Dobbins, you'd be aware that the Premier's memorandum, or you may not be aware, M 2022-05, the New South Wales Public Sector Wages Policy is still showing on the website of the Cabinet Office as being active, are you not? Is that not the case?
Yes, Mr Tudorhope, as you raised with me at the Premier's hearing, I looked into that and you are quite correct that memorandum is still live.
So, given that the wage cap no longer exists because of the lapsing of the regulation, I take it as the case that the other provisions of the memorandum are in force, are they not?
That's correct. So we took a decision not to retire that memorandum because, as you know, it contains the governance arrangements for how the government considers policy aspects. And until the task force finishes its work and the government responds to that report, we can't issue new governance, and we felt that it was necessary to have information for agencies about how to go through the process of getting government approvals for bargaining approaches.
Thank you.
Just Mr Tudorhope, in the absence of any crossbench members, and I don't have questions, you're free to continue on.
Thank you. We might get an early mark, Chair.
We might.
We might.
Be mindful of
Even
that. We're in your hands.
Well, that memorandum provides at clause 2.5 that no offers may be made in relation to an increase in employee-related costs until bargaining parameters have been improved in accordance with the policy, which is just as you've just outlined. So there is a process for approving those offers. An increase in before they are made. Is Treasury still responsible for an analysis of the financial impacts of proposals, and do they provide advice on financial and economic matters as required to assist your determinations?
Yes, they do.
And who in Treasury is responsible for that?
I'm afraid you've got me. I can't remember the name of the
on
branch.
notice, can you provide me with that?
Yes, I can.
Is there a Treasury framework for performing, for the purposes of assessing employee-related costs or increases in employee-related costs?
Quite possibly, but that you'd have to ask Treasury that question, I'm afraid.
Well, if I put it to you that a part of that framework would involve pay increases not being outside the $3.6 billion Essential Services Fund, would that be what they would consider you should be taking into account for the purposes of considering employee-related increases?
I can't talk to the Treasury approach because, as I say, I'm not across the fact that they have guidelines or if they do what they say.
Good. You want to go now?
Sure. I might turn back to silicosis. I'd ask the Minister, this would be good maybe to elucidate on the transition arrangements for the industry, getting them ready for the almost eventuality or foregone conclusion that there will be a ban on manufactured stone. So any update you can provide on the support for the industry to transition to the removal of manufactured stone.
Yes, so the decision that was taken in late October by Work Health and Safety Ministers was to release the decision regulatory impact statement, which is now available to everybody. They'll be meeting by the end of the year to consider the decision regulatory impact statement and determine whether a decision will be taken for the banning of engineered stone. It's then at that meeting that discussions will take place or expected to take place in terms of those transitionary and implementation processes.
Has any consideration been given to raising awareness, education with the industry, with tradies and providers, because we don't want it to come as a huge shock to them when you're bringing in a change like this?
Yeah, the industry has been making representations to the Minister's office. We've seen some correspondence from a range of industry businesses, so they're aware broadly, is my understanding, that the changes are potentially coming through.
And has any consideration been given to financial support? Obviously some businesses would be radically disrupted by that process to transition away from manufactured stone.
That will be a discussion and decision for the Minister and the Government once those discussions take place with all ministers from states and territories and the Federal Minister later this year.
And in terms of the licensing scheme and the register for at-risk sites, which industries will be captured by those?
The licensing scheme is as well linked to the implementation decision, so that the details are not yet determined, but it's expected that that would cover all of the remaining industries that are related to silica.
And the register for at-risk sites, is that going to be separate from the register of workers? Like there'll be two separate registers?
The licensing scheme and registry is up for discussion at the end of the year, but it is separate to the silica workers registry at this stage, yeah.
Fair enough. The $6 million over 3 years to the Asbestos and Dust Disease Research Institute, you aware of that funding commitment?
No, I'm not across the details of that. I know the Lung Foundation's also been doing some work on behalf of federal government.
Could you be able to maybe take on notice an update for us on where that's at?
Yeah, we can take that on notice.
Thank you. And what does tracking workers involve with the health screening?
Yeah, so at this stage we're using the New South Wales Dust Disease Register to have workers nominate into that scheme or to be registered with that scheme where a diagnosis occurs. And then the health monitoring arrangements are probably more with Mr. Harding and his team in terms of making contact with workers and helping them with the health screening process.
Is it compulsory to be on that register, or can someone opt out from being on there?
My understanding is that workers will opt into that, and we'd be seeking for them to opt into that. There are some mechanisms for workers to be registered if they're picked up by GP, is my understanding. I can take that on notice if it needs.
Perhaps I can help, Mr. Wright?
Yeah, sure.
It is compulsory for doctors or screening facilities, if they identify silica, to notify or put someone on the register, and that triggers for us then awareness that that person has been identified, and we can then track them and encourage them for continued scanning so that we can determine their eligibility for the scheme.
Yeah, okay.
Support.
Thank you. And obviously the uncontrolled dry cutting is currently banned, but has Safe Work checks indicated compliance with this ban?
So what we've seen since 2018 through to September this year, we've undertaken some 2,443 inspections.
Sorry, 2,443?
2,443 inspections in relation to silica. 1,218 of those related to engineered stone businesses. 1,023 were construction sites, and 202 were other industries. What we've found is that there has been an increase in compliance with a range of measures that are required to improve safety around exposure to silica. In our final round, which we undertook over the last few months during 2023, we did target those businesses that had repeat notices in round 1 and 2. We did target those that have previously been issued both penalty and prohibition notices, and those businesses that had the highest exposure to exposure monitoring results, and also those with the highest diagnoses of silicosis. We have seen increased compliance across the industry, but we are still seeing some non-compliance, particularly with smaller businesses, that is of concern.
So compliance is up. Is inspections also up, or are the number of inspections down over the last 12 months?
So I don't have in front of me the number of inspections over the years, and I can get those for you and take those on notice. But the third round of inspections we did was more targeted to those businesses that had non-compliances and those factors that I just read out in relation to round 1 and 2. So they're very specific and very targeted to those areas of industry that we were more concerned about.
Maybe 2019, 2020 figures, and then 2022, 2023 figures. Just some evidence that I've heard about the inspection rate going down, but the compliance rate going up. And that might be because it's more targeted to specific sites of concern rather than a broad sweeping approach. But yeah, those two financial years would be good to compare if possible. All right, that's probably it on silicosis. Want to move to the gig worker safety issue. So has there been progress made on a discrete and enforceable code of conduct for WHS by on-demand platforms?
Yeah, there has been progress made. That's progressing at a national level. So the code of practice is still underway. In the meantime, SafeWork New South Wales has been developing 2 guidance documents to support both the food delivery riders and also those working in disability and aged care. So we are seeking to take a national approach with the code of practice, and that's progressing.
Great, thank you for that. And the Minister pretty much answered my question on this regarding workers' compensation benefits to gig platform workers, saying hopefully the first half of next year. But can you give any more detail on the delivery of that commitment and what progress is being made on that?
I'll pass it over to Mr. Harding.
We've been asked for some advice via CIRA in that respect. I'm not sure that we know the timetable, so we provided some advice in a relatively short timetable, but I'm not sure how that will be progressing forward to a decision process.
So
we're really not the agency that gets involved, so it's a CIRA
It's a
driven
CIRA thing.
Yeah.
Okay.
outcome.
Yeah, all right.
Yeah.
All right, no worries. Probably just moving to mental health. So last year regulations were made requiring employers that they must manage and control psychological hazards and risks. How is SafeWork educating PCBUs on their obligations?
Yes, so we've had a strategy in place over a number of years. That's the 2018 to 2022 mentally healthy workplaces strategy that has mapped out all of our advice and education and compliance functions in relation to psychological safety in the workplace. We are currently going through a process at the moment of redoing that strategy and also working at a federal level to make sure that all of those appropriate strategies are in place. We also have the code of practice for managing psychosocial hazards at work. You might have seen that also in the last few weeks we have released our Respect at Work strategy, which is making sure that sexual harassment in the workplace is seen as a work health and safety issue and for SafeWork to play a really important role in providing advice and guidance and providing tools for PCBUs, but also to provide avenues for workers to report their concerns in relation to sexual harassment in the workplace. This is one of the first times that's happened in the country in terms of having a bespoke team in place and having a strategy that directly looks at sexual harassment in the workplace.
Yeah, no, thank you for that. I did see that. Has there been any compliance actions taken with the new requirements for managing and controlling psychological hazards and risks?
There is compliance activities undertaken. I am aware of a couple of matters that we are currently, that are with our investigation team that potentially could lead to prosecution.
Right.
But for specific information, I would have to take that on notice.
Okay, no, that would be great. And what are inspectors seeing on the ground in terms of compliance? Is it is the general trend improving in terms of compliance, or is there concerns on the horizon that need to be addressed?
I think broadly, we all know that, the claims for psychosocial impacts in the workplace are increasing, and that's a concern across all businesses. So our teams are responding as best as possible to provide advice, and where needed to undertake compliance activities within PCBUs. We do encourage people to report any concerns that they might have in relation to work health and safety in psychosocial and other matters. And as I was saying before, through our Speak Up app, people can do that anonymously and take action within their workplace.
Does SafeWork have the tools and resources to conduct sufficient proactive compliance operations?
Yes, SafeWork conducts quite a large amount of proactive activities, as well as our reactive compliance activities. There's quite a significant resource allocation towards proactive education and advice programs for PCBUs.
And what about timely complaints investigations? Are there any delays that might be of concern due to lack of resources?
We use a triaging process. That process is currently under review by Justice McDougall, and that will give us some insight into whether we need to do some more work in relation to that triaging process. But at this stage, all matters come into SafeWork and go through that triaging process.
Thank you. And then just one more, sorry, I forgot to ask this about silica. Go back to that. Has any consideration been given for looking at increased regulations or banning of concrete, granite, marble or cement that also contain high levels of silica? Or is it essentially just the manufactured stone bench tops?
At this stage, the decision regulatory impact statement just focused on engineered stone in relation to a ban. If you like, I can give you those numbers that you requested before in terms of silica engineered stone proactive visits undertaken by SafeWork year by year. In the year 2018 and 19, we undertook 510 visits. 2019 and 20, we undertook 118 visits. 2020-21, we undertook 210 visits. 2021-22, we undertook 105 visits. And in the financial year 2022-23, we undertook 152 visits.
What was 2018?
2018-19 was 510 visits.
So why were there so many? Why was there such a significant number in 2018? Like 2019-20, from 2019 to date, it's been all a similar type of number, sort of nothing really that interesting. But the 2018-19 was significantly higher than the other years. I know maybe there was a bit of a drop-off during the 2 COVID years, made it a little bit difficult, but any rationale behind the numbers there?
Yeah, my understanding is that we sought to identify every engineered stone fabrication firm in New South Wales, and we undertook visits with them in round 1 in 2018. And then we undertook to focus on those same businesses in 2019. There has been a drop-off in the number of businesses in the industry over that time, is my understanding. And then in the later years, of course, we've focused on those organisations that have had multiple notices and taken a really strong risk-based approach to dealing with businesses that need some support in gaining compliance.
Okay, great. Thank you. Thanks for that.
Mr. Houston, just returning to issues relating to long service leave, there was a case, I think, that you were conducting, which review arose out of a case called YPRO relating to long service leave and the continuity of long service leave. And I think the National Australia Bank, correct me if I'm wrong on any of this, has there now been a settled decision in relation to the continuity of long service leave so far as it is in fact I suppose, portable commodity from employer to, or region to region, or employer to employer?
There was a decision, I think it was the Wipro decision, but I'll confirm that if that wasn't the name of the case, which considered whether or not service of an employee in another jurisdiction would count for the accrual of long service leave purposes. That was a matter was commenced by the employer in the Supreme Court seeking a declaration. So it wasn't something that was initiated from our side of things, but the conclusion of that was that in that case the service of the employee in another jurisdiction did not count for long service leave purposes.
Did the government appeal that case?
No.
So the current position is that an employee who worked for, and I think this was the facts of that case, was employee who worked for a company in India who transferred to the same company in Australia. That service in India was not counted towards long service leave in Australia, is that correct?
That's correct, but as you'd appreciate, each individual case may vary. The commencement of that person's employment was in India, so it might be a different scenario if someone was to commence their employment in New South Wales. Or, yeah.
So it would be different, would it be, if it was within an Australian jurisdiction?
It comes down to a question about there being sufficient connection with New South Wales for the service to count. So in that particular circumstance, the service in India didn't count. And that will have implications for how we consider service in other jurisdictions for other compliance activities.
Thank you. I've just got one question before we hand over to Ms. Boyd. How many workers have opted in to the dust diseases eye care scheme in terms of the engineered stone?
I might just try and clarify your question, Chair. Just when you say opted in, I think we were talking earlier about the screening program, which is about tracking people versus people who are now eligible for the scheme and actually have been receiving benefits, which are two different things.
Yeah, well, okay, the first one, or we'll deal with both.
Both, right. So we have been increasing the amount of screening, as you'd know, and we've done now 3,433 throughout the 2022-23 year, of which that led to 55 new scheme entrants, so 55 people with diagnosed silicosis that enabled them to join the scheme. I'd highlight though that of the people who are screened...
Sorry, Mr. Harding, that was this last financial year?
That was 22-23, yeah. And if you'd like a current figure up to 30 September, we've done 1,008 this year, of which 33 new participants have entered the scheme. What I was going to highlight...
sorry to interrupt again, Mr. Harding. And how many in total have been screened over the entirety of the scheme and are in the scheme now?
I'd have to get... I don't have that number, believe it or not, on hand. I can bring that back for you.
Thank you.
I think one of the...
take that on notice.
Perhaps, yes. One of the... which I think is relevant to the question you're asking, the majority of people who are screened have no symptoms and very low impairment levels, what we would classify as less than 1% impairment, which means they don't qualify to be part of the scheme. We do track those people and we encourage them to come back for annual screens or to use their medical professional to help them with further screening on a regular annual basis, so we can make sure that as the disease might develop, or if they continue to get exposure through their work or other avenues, that we can track them and ensure that they're getting support if and when they do start to qualify for the scheme. So it's not just the individuals who are coming in, but we're tracking now these people with what we call less than 1% exposure, so we can keep track of those. But I'll come back to you on notice with the total numbers that you're asking for. The scheme's been going since like 1947, so I assume you don't want the whole history, you just want the last 5 years or the last 3 years?
So do you differentiate between, like quarry workers, tunnellers?
We can.
You do?
We can if that's what you're after.
Yeah. How many? Yeah, I would, if you provide those figures. Do you have an estimate of how many people working in the engineered? How many people there are that in the engineered stone workspace there are in New South Wales?
No. And we've worked closely with Safe Work team to try and make sure we identify and gather as much information, so we try and triangulate that. We've talked to the unions to try and get them to help us identify employers and sites. So we're continually trying to find that, but there is not a known holistic list, if you like. We reached out.
So just in terms
year,
of establishing a register, if that does happen, we basically have to start that process after.
It would certainly assist our efforts to make sure we had a complete screening. I think one of the things, obviously.
But it's not like well, sorry to interrupt again, but it's not like you've sort of basically got a list that you have to formalise. You're going to have to go out and find those.
Well, we'll be able to tell the ones we've already been involved with.
Yes.
Which I would hope would be the majority. We recently, in April last year, ran a program with Caesarstone, and obviously they have the majority of the market share in respect to that manufactured stone. And we went out over 4 different occasions and screened over 370 of their workers. We worked very collaborative with them to make sure that they helped us identify, because a lot of the times these employees are contractors or subcontractors for the cutting, especially the on-site cutting. So identify the people who are associated with them for the fitting of stone, and that we could get as much coverage as we could. Of those 370, that there was 55 who were new diagnoses, 12 that were existing that we already knew about, and then 303 who had no exposure. So programs like that I think we keep going out and trying to make sure we get full coverage. I can give you some numbers now. My team's just sent me between 19 and 20, sorry, FY19 through to September 23, there's been 13,014 people screened, and there's 265 in total in the scheme who have qualified from a silicosis basis.
Thank you, Mr. Harding. Ms. Boyd.
Thank you very much, Chair. Perhaps I could start with you, Mr. Harding. You'll be familiar, I'm sure, with the case of a Ms. Maloko and another woman that she's been representing in relation to their complaints, in relation to the way that their claim was handled within iCare. There was a letter that you wrote in September to Ms. Maloko, generously apologising for the mishandling of that claim, and I think you'd agree it's led to some really good changes and good reforms within iCare's complaints handling.
More to come. Yeah.
More to come. Yep, excellent. Do you think? I'm sure you're aware of the aspect where it's claimed that a CERA employee basically took her information and distributed it to places where it should not go, compounding her distress. Do you think that the way that CERA has handled that aspect of things and their investigation subsequently into the breach of her privacy has been appropriate?
I'm not entirely sure that's the right place for me to comment. I'm not aware of the nature of the investigation. I referred Ms. Maloko's complaint to me, to Mr. Dent, and I suggested to him that it might be a PID, and he's then undertaken his own investigation process with that. I haven't seen or been provided any feedback on the report. So I don't know enough to be able to give you a view as to whether it was an appropriate approach or not.
Yeah. So an investigation was conducted by PwC in relation to the complaint Ms Moloko raised. Unfortunately, CIRA's not going to release that report or let her know what the results of it is.
So they haven't, also, as I said, they haven't provided to us either.
No.
Which really we're not a interested party.
And I understand,
that
but
they regulate us.
So I was just talking to Mr Dent in the other room, the other estimates, and I was asking, do you think for someone who has gone through everything that she's gone through, to make a complaint and have it go through that investigation, give all your information to PwC, go through all of that, but then to never find out what the result of that investigation was, do you think that that is at all appropriate?
It's very hard for me to say because I don't know the content of the investigation. There could have been privacy matters in relation to the issues that meant that it was not appropriate. I don't know. I think my view would be that people like Ms Moloko have been treated by the scheme in the history, and I'm aware of a number of them that have come through my complaint centre, if you like, the people who write to me. And at a period in time, the scheme has really let people down. And so we're trying to rebuild that and to make change to ensure that that doesn't happen again. I can't guarantee it won't, but I can try and ensure that the things that we put in place remove that possibility. The issues that you're raising are really difficult for me to comment on because I don't know the details, and there are circumstances that Mr Dent would be aware of, or that Ms Hogan would be aware of, because it was run through, my understanding, it was run through Department of Customer Service.
Yep.
That I'm not aware of. So it's very difficult for me to provide you with opinion, which is what you're asking for.
No, I understand. Mr Dent, and I've just read this onto the evidence in the other room, but Mr Dent sent Ms Moloko an email in March of this year saying, we won't be responding to your communications anymore. Then the investigation has happened, and now there's nothing. I guess I'm looking for somebody to step up and say, well, actually, that's not appropriate, and we should be doing better by people who have been sort of chewed up by our system and spat out the other end.
Yeah, so maybe what I could say is this. There are people who've come through the system with significant psychological trauma. And being open and hearing them and being willing to listen is fundamental to helping them recover.
Thank you. I'm going to move on. Perhaps I can turn to Safe Work, Mr Curtin. How many Safe Work inspectors are currently employed?
We currently have, I've got it here, just give me a moment, 370 inspector roles, and 359 of those are currently filled.
359 are filled, and is that full-time equivalent?
Yeah.
Okay. Do you have any records of how many of those inspectors, or how many? Let's start with how many inspections there have been of construction sites where there may be silica exposure? Do you have that sort of data?
I don't have that with me. I'd have to take that on notice.
So when we're looking, obviously, when we're looking at the silicosis issue, banning the manufactured stone used for kitchen benches and things is kind of the obvious one and the low-hanging fruit, which is why I'm continually annoyed that it's not just been banned, but it's much harder when we're then talking about all of the construction in tunnels, etc. What I'm hearing from workers is that Safe Work are simply not inspecting those sites. Do you have evidence to the contrary?
Yeah, I've got some numbers. We ran through some numbers just before, but in terms of silica inspections from 2018 to 30th of September of this year, we have conducted 2,443 inspections.
Does that involve air monitoring?
air monitoring is one of the components that's inspected as part of that, if it's relevant to the organisation. I can give you some numbers on specific tunnel inspections that have been taken this year and in previous years. So in 2000.
So sorry, that was total inspections, was it? The
2,443 total inspections across engineered stone, construction
engineered stone.
workplaces
Yep.
and other. Yep. And specifically in tunnelling,
Yep.
we've done 32 visits this year so far.
How many unannounced?
I don't have that with me. I'd have to find that for you.
And would each of those visits involve air monitoring?
I'd have to confirm that for you. Maybe take that one on notice. Yeah.
Thank you. I understand that one of the areas of concern from workers is in relation to a lack of mask fit testing, which is unfortunately not constrained just to this industry, but obviously it's something we hear from nurses, for example, as well, that Safe Work is not enforcing the fit testing process. Do you have any evidence of that being enforced by Safe Work inspectors? Is this something that they're checking?
Yeah, so I've met with the Nurses Union myself, and we've had this discussion around fit testing, and my understanding is that it is captured in the Australian standard, and it's
It is,
a
but
requirement.
is Safe Work enforcing it?
So we've made a commitment to the Nurses Union to do some work to improve information on our website and to work with our inspectors.
Which is great. So that's nurses, which is very critical. And then when we come to workers who are working in tunnels where they're exposed to silica dust, what are we doing to ensure that their masks are being fit tested?
Yep, so that's part of the inspection process, is looking at fit testing of masks, looking at wet cutting, looking at ventilation, and looking at air monitoring results as well.
How many infringements have been issued or any sort of action taken in relation to those tunnelling inspections?
I've got infringements issued, but not specifically to tunnels. So we have in our final round of inspections in 2023, this is across the whole industry, we have issued 111 notices.
11 notices?
111 notices.
Oh, 111. 111 notices across the engineered stone construction industry?
Correct.
Yep.
In relation to tunnelling, we have issued 2 notices for air quality.
2 notices for air quality.
In 2023.
One of the things that my office is being told is that inspectors are reluctant to go into the tunnels because they're worried for their own safety. Is that something that has come across your desk, and is that something that you've heard as well?
No, not that they're worried about their own safety, but entering large infrastructure projects, subterranean, is a challenging work environment, but inspectors get into those areas anytime they choose to.
What about ensuring that workers in those kind of tunnelling situations are given adequate information and access to screening afterwards for silicosis? Is that the same program as is applying for engineered stone workers, or is there something different? Do you know?
They're captured in the same way as my understanding in the New South Wales Dust Disease Register, but I can take on notice to come back to you on that.
Yeah, if you could, that would be really useful, just to give a bit more, because I think that's probably the next area of focus once we've dealt with the manufactured stone and the kitchen benches. Thank you for that. We were going to come back to this standalone Work Health and Safety Regulator for New South Wales and the timeline for that excision of Safe Work New South Wales from DCS. Do you have any more detail on that?
Yes, so as you know, the McDougall report or the McDougall review is underway. That's been underway since October 2022. That's expected to finish mid-December this year. we've undertaken a phase 1 approach in preparation for that to support the separation of the Building Commission out of the Better Regulation Division, which will see SafeWorks staff reporting through one line to my role as at 1 December of this year. That's an interim phase 1 approach just to separate those resources out so that the Building Commission and Fair Trading and SafeWork can operate under separate streams within Department of Customer Service. And then any decisions or any review of the report that comes through from Justice McDougall will take place early next year.
Thank you. Just in relation to that, the World Congress, the WHS World Congress, I understand that $15 million was forecast in the budget for that. Is there an updated forecast for that?
The expected net cost is $5 million, which is being funded from CIRA.
$5 million, sorry, funded by CIRA?
Funded by CIRA.
Do you know if there's a projected sort of surplus or deficit for the Congress? Are we going to get some income back out of that, or is it all expenditure?
It's tracking at about that rate. So the revenue is forecast at $6 million.
Okay.
And the cost is forecast at $11 million. That's on budget as expected.
Okay. The website for the Congress indicates that there are currently only 3 major sponsors, one of which is iCare. Do you know how much the Congress has raised through sponsorships?
I don't have that with me. There are a number of sponsors. I can take on notice to come back to you on the sponsorships that have been offered so far.
Thank you. Mr. Harding, do you know if iCare has paid money for that sponsorship of the WHS World Congress, sorry?
Yes, we agreed to support a mental health program that's being run during the session. I think, and I'm talking off the top of my head, so maybe I can get it for you on notice, but I think it's around about $40,000.
Cool. All right. Thank you. And I think I'm going to be out of time. Yeah.
Have you got any more you want to ask, or are you done?
Can I ask one more?
Yeah, sure.
Just finally, the issue on that crane at the new Sydney Fish Market site. I was interested in knowing sort of what sort of precautionary work was done by SafeWork inspectors in relation to that innovative new crane prior to the incident.
Yes, so we've got a really dedicated team of inspectors that work really closely with infrastructure projects. They're part of our construction group. That team has been working with the Sydney Fish Market redevelopment since its inception, and working really closely with HSRs, the contractors on site, the safety committee, to make sure that all the safety arrangements that need to be in place for some of the really specific development elements of that site are taken into consideration, including the coffer dam and some of the other, kind of specialist construction that needs to occur there. So there has been a pretty good relationship there that played out when the crane did collapse, so that our inspectors knew all of the people who were on site, all the stakeholders, and undertook a really collaborative process to make sure that the right prohibitions were put in place and the right plans were put in place to get workers back on site safely as quickly as possible after that incident occurred.
Yeah. Thank you.
Thank you. We've had 2 rounds of opposition and crossbench questions. Ms. Boyd, do you want to ask more questions?
No, I'm done, thank you.
Okay, thank you. Well, then we'll just go to the opposition to run out the clock.
Mr. Houston or Ms. Dobbins, in relation to the federal government's Fair Work Amendment legislation, the loophole legislation, when was the meeting of Industrial Relations Ministers for the purposes of considering that legislation?
I don't think we've got that exact date in front of us, Mr. Tudorhope, but happy to take it on notice.
But you do recall that there was a specific meeting of the Industrial Relations Ministers to be consulted in relation to that legislation?
My recollection is that the legislation, the bill, was not put to that meeting of ministers, no.
Well, in relation to the obligations which arise pursuant to the Memorandum of Understanding in respect of the referral of powers under the Fair Work Act, is there not an obligation under that Memorandum of Understanding to consult in relation to any changes to the Fair Work Act?
That's correct. So the consultation occurred, but my recollection is that the draft bill was not put to the ministers at that meeting.
So a consultation occurred without a draft bill?
Consultation with the ministers at that meeting did not contain a draft bill, no. All the jurisdictions have been consulted in relation to the bill subsequent though.
Did New South Wales have a position in respect of that legislation?
Yes, it was a position agreed by the Cabinet.
Was there any stakeholder consultation, to your knowledge, before that position was adopted?
Consultation was undertaken by us. I couldn't speak in relation to consultation undertaken by ministers.
In relation to the consultation undertaken by you, was there a summary document prepared in relation to the position of stakeholders in relation to the proposed amendments?
Might have to ask my colleague, Mr. Houston.
Not that I recall.
So is it true to say that New South Wales adopted a position in respect of the legislation without a comprehensive consultation with stakeholders?
Well, there has been a draft bill that's been presented to Federal Parliament, which has been referred to an inquiry, which I think is reporting back in February. There have been numerous media reports in recent months about variations to that legislation, so we will inevitably be providing advice about what is a more final form of legislation, given its a state of flux.
Did the New South Wales government make a submission in relation to the Senate inquiry?
No.
Mr. Draper, is there a New South Wales government position in relation to a policy for working from home?
There's quite strong support across the sector for flexible working. That's very different to working from home. Working from home can be an element of flexible working, and as you know, during the COVID pandemic, that became a requirement where possible for people to be able to work from home, but that's not part of our standard working policies, no.
So in respect of the flexible working policy, has any analysis been done in respect of the manner in which that policy position is implemented? And I'll give you the example. For example, are you able to ascertain the number of people who adopt flexible working hours on Mondays and Fridays?
The one piece of information that is quite helpful in understanding people's working practices and the use of flexible working is the People Matters Employment Survey, which is actually, I think, just coming out this week for 2023, and that data is collecting that on how many people utilise flexible working and the types of working patterns that they use for flexible working and people's satisfaction with it. So that's quite a good source of information. I don't know that we routinely collect the days that people work in the office and work from home. People are out of the office for all sorts of reasons. I'd say probably the majority of our people in the public service aren't in offices at all. They're out doing other things in hospitals, schools, in the police force, etc. And those who have more of an office-oriented work, their working patterns are dependent on the circumstances of the services that they're providing to the people of New South Wales and the requirements of their employer. Just generally speaking, the approach in the organisations that I've been involved in is that we do seek people to be predominantly in the office, and there's a whole range of reasons for that, not the least being that the public service as an institution, it's very hard to build an institution and maintain an institution like that if people aren't working together and you aren't developing young people.
So is it correct to say that there's a positive encouragement for people to be in the office, so to speak?
Yeah.
wherever that office might be.
Yeah, I think that's right. Yeah, and certainly for me as the Secretary of the Premier Department.
So on an agency basis, are you able to say which agencies have adopted that as well, not necessarily as a policy, but as an encouragement for staff?
Yeah, I think we are able to determine. I don't think not all agencies have a very clearly stated policy. They have a way that they encourage people to work, so it's not uniform across the public sector. But the general approach that people should be spending a reasonable amount of time face to face rather than working from remote locations, I think is a fairly common aspiration for most organisations.
Have you been able to identify workspace which has not been occupied, which had previously been occupied as a result of the adoption of workplace arrangements where more flexibility is given for the people to be flexible about the location of their working position?
I haven't identified that, but I haven't tried to identify it either. I think probably the part of government that would have the best appreciation for that would probably be our Property and Development New South Wales. They who are managing all of our accommodation needs. But there's certainly no question that we don't set ourselves up in terms of office accommodation on the assumption that we'll have 100% of our people there at any given time. There's sort of an assumption that there'll be people out of the office at meetings or out and doing other work, and some people working from other locations.
So is there a figure on which property would work for the purposes of their requirements for office space?
I'll check what figure they use. I won't guess at it, but I believe they do have working assumptions around that. Yeah. Because
there potentially is savings to be made, is there not, in relation to, I suppose, disposing of unused workspace?
Yeah, well, we absolutely have a desire to be efficient in the use of our accommodation that we have available. Having said that, I don't want to get to a situation where we've been so economical on having physical workspaces that people can't come and work together. I don't think that's not great for building a strong public service. People need to be able to come and meet and work in the same workplace.
Mr. Harding, it's lovely to see you.
How are you, Mr. Chair?
Always well. Mr. Harding, there was a drawdown from the general government sector of $699 million for a contribution to iCare. That was a reduction. Last year's figure, I think, was $1.9 billion. Why was there a reduction in that figure?
As you would know, Mr. Tudor-Hope, the TMF operates on a policy called the Net Asset Holding Level Policy, which sets a baseline for the solvency level of the TMF scheme. In the prior year, as you mentioned, that 2021-22, the scheme received an injection of $1.9 billion from the state government. That was heavily driven by the environmental impacts of the storms that year. So the catastrophic weather events and floods across the year totaled about $310 million. Rising historical abuse claims were about $290 million. Increasing medical malpractice claims were about $170 million. There was impacts of the investment market in that year of $600 million. And so forth. Increasing psychological claims in the public sector about $370 million. In the 2022 year, less impact of storms. So the flood impact in July and October of 22 was only $150 million. Child abuse claims became the major contributor to the shortfall. Over $500 million in the TMF and $190 million, so a total of almost $700 million across the TMF and the pre-managed fund, so the legacy part of the scheme. And then the other contributor is the police medical discharges scheme of $200 million. So different makeup of events, but it's what the TMF is supposed to do and what the NAHLP is supposed to do, which is absorb the risks of government.
Yep.
and the NAHLP is the mechanism by which the government tops up the scheme when those liabilities grow beyond the expectations of the government.
Have you made projections for next year? Not that you are a weather forecaster or an earthquake forecaster, but on the basis of those quantifiable risks which you've identified as part of that, whether it's sexual abuse claims or mental health claims, have you made projections potentially as to what that figure might be next year?
The answer is yes. So we do in our budget forecast our expectations, but as you say, we don't budget particularly for weather impacts. So it's not a particularly robust outcome, and that number I think has been included and released by the Treasurer in one of his statements over the forward estimates, I think.
Yeah. Well,
But I don't have it in my head, so if you'd like it, I can get it for you on notice.
One of the things that I wonder whether you have done, Mr. Harding, is this: have you done any modelling about wage increases in respect of potential impact on either the nominal insurer or the TMF in terms of claims?
Yeah, so in the liability valuation work that happens every 6 months for the actuarial providers that we use, regularly forecast average weekly earnings growth, or actually wage price inflation is probably more relevant, and similarly in general inflation and in interest rates, and those are forecast out over 10 years. They generally use a market rate in the sense of the sort of 3 or 4% numbers that are more commonly known.
So what is the figure you're using currently for wage increases?
Do you have that? No, we might have to get you that on notice, Mr. Tudor Hope. I'm sorry.
That's you will see from the budget papers, Mr.
Just,
Harding.
Mr. Tudor Hope, it'll be a different rate each year, so I'll
Sure.
provide you with the pattern that we forecast out of this.
I entirely appreciate that. If you go to the budget papers, one of the risks to the budget is this, and if I can just quote from page B-7, insurance risks are managed through the state self-insurance schemes and commercial reinsurance, the largest being the TMF. There are increasing pressures on the state's insurance liabilities driven by rising costs and claims relating to psychological injury, medical discharge, medical malpractice, historical sexual abuse, cyber, flood damage and other emerging risks. There is a significant risk that these pressures will result in higher than currently estimated costs. That doesn't include increased wage pressures, does it, those figures? Would you include increased wages as an insurance risk?
Well, the forecast that the actuaries use over that future 10 years will be already embedded in our current liabilities. So that, to the degree that there is a variance from that forecast, it's not included in and it would be a part of that risk that you're talking about.
Do you update your forecasts?
Every 6 months.
So potentially, given wage fluctuations and inflation fluctuations, the forecasting that you would do could change.
Absolutely. And it's part of the volatility of all insurance businesses, especially those with wage-related support.
Mr. Harding, the Treasury is conducting a review into an operational review into iCare. Have you seen the terms of reference for that review?
We have received a letter from the Minister that outlining her intent. We haven't yet done any work with our Treasury colleagues to lock in a terms of reference. No.
Ms Campbell, have terms of reference for that review been prepared?
No, we haven't provided anything beyond the letter that the Minister has sent to iCare.
Well, what is the letter to? Can you provide on notice a copy of the letter which has been sent to iCare?
Certainly. Yeah.
And it involves specifically, as I understand it, a review of wages and other expenses.
I believe the focus is our operational expenses.
Operational expenses?
Yeah. So if you think about the scheme, and the total scheme, around about 76% of the scheme's costs relate to claims costs.
Yep.
And are in actual benefits paid to injured workers in terms of the nominal insurer focusing on. About another 12% of the costs are then claims handling costs, so costs in actually administering those claims. 6% of the costs are our operating costs, the costs of running eye care, management, overhead, boards, governance, risk management, all of the things that you would expect in a normal, large, multi-billion-dollar organisation. And then a further 6% is related to the CIRA funding that we provide from, in the case of the nominal insurer, from employers' contributions. And that's the funding that then goes to Safe Work, the IRO, and the Independent Review Office and the Personal Injury Commission. All of those are funded out of the 6% that CIRA allocates.
So, yep, go.
So my understanding of the scope is the 6% that relates to our operating expenses and how we can better optimise those. And I think we welcome the opportunity to review. It fits well with the other transformation programs we have going on in terms of the post-McDougall remediation, and we look forward to working with the Treasury team to sort of further enhance that and make sure we've got our I's crossed and T's dotted.
But you've got a Chief Financial Officer who's sitting here. Wouldn't the Chief Financial Officer be always, in fact, conducting exactly that operational review in relation to the manner in which the organisation runs?
Absolutely, and we do that as a matter of course. As you would know, I've come from the private sector, and focusing on those costs and those the efficiency of the operations is a very key part of what we do. We have run our own program of optimising the costs between 2020 and 2022. We removed over $131 million of costs from our operating costs, and that's a starting point for us to have already managed that. We're reinvesting some of that now in terms of improvements to the scheme, but I do think continued focus on it is very normal from my point of view as a private sector commercial insurance company operator that you want to have that focus. So,
but you would have thought that in fact your board would have been requiring that level of focus as well, would it not?
Which they do. They review our budgets and undertake a thorough assessment of what we're expecting to spend each year, and then each initiative that we bring forward, must contain an appropriate business case with a solid return. So the board does provide a level of oversight and governance already. Is.
So, to conflate that review with the drawdown which the government contributes to iCare is probably a mistaken approach to actual savings, is it not? So the $699 million, would that be improved by this review?
Highly unlikely.
And to, in fact, suggest that because we've had a $699 million drawdown, that's influenced by one set of factors. It's not addressed by having this operational review.
I think we need to see how the operational review goes. I understand the point you're making. It is very common, in my experience, for people to get iCare confused as to what part's what, and to confuse that, and colloquially, to some degree, over the last 3 or 4 years, the injection into iCare or a bailout of iCare has been used as a way of describing the NAHLP, which is a different mechanism. Yep. The operations of iCare support all the schemes, and making sure that they do that in the most efficient and effective way, I think, is the intent behind the review, and we welcome that part of it.
Yep. Have you conducted any review of your return to work policy?
Maybe you could be a little bit more specific.
Well, one of the matters which you have been quizzed on year after year is deterioration in return to work policies, although I think last year there were some, as you correctly described them, green shoots in respect of the 13-week return to work position. Has that continued?
Yes, we continue to see some positive movements. It's very probably slower than people would prefer. The 26 rate in the nominal 26-week return to work rate in the nominal insurer has gone from about 84% in 2021, June 21, to 86% in June 2023. And the 26 rate is probably the good benchmark to use. The 4-week rate tends to move around quite a lot. In the Treasury Managed Fund, it's gone from 86% to 87%. They're very early and not what people would expect in terms of large changes, but they are significant impacts. Actuarially, when we do those liability valuations, they're a very good insight for us in terms of the health of the scheme and what's actually happening. And in the last 18 months, we've been pleased to see almost 700 million, about $680 million worth of releases being generated from the work we've done on early intervention, on work capacity in terms of making sure that that's well understood, and on the improvements we're making to the claims model. So that tells us that we're heading in the right direction. There's a lot more to do to improve return to work outcomes, but there are, as you say, some green shoots and some the start of a movement in the right direction.
I did ask the Minister about that, and it does give rise to some concern in respect of potentially the policy framework in relation to return to work for mental health claims.
Yes.
And I know you would be very concerned about this, but is there any proposal that you're aware of or have had any input into in respect of how you would improve return to work rates both in the TMF and the nominal insurer in respect of claims for mental health injuries?
There's no legislative proposal, if that's what you're asking. We operationally are doing quite a lot. Within the claims model that I talked about earlier and the 6 new providers that have come on board, 4 of those providers have specialist, qualified as specialist claims providers who have a team specifically focused on psychological injury and on how do we create a different way of managing it instead of trying to bring psychologically injured workers through the one sausage factory, if you crudely think of it in that context. How do we change the way we interact with people so that we can help get better return to work impacts? We ourselves are running, we have an office in Wollongong where we run a test and learn centre, which is primarily focused on making very small but quite meaningful changes to the way we operate and the way we manage claims to help us get the handle on what's actually going to have the biggest impact on changing return to work outcomes for psychologically injured people. 9 out of 10 people with a physical injury at the 26 weeks will be back at work. It's 5 out of 10 for people with psychological injury at the 26 weeks. So a significant difference in return to work between the two. That Test and Learn Centre has helped us already identify cases where just simply, especially with small business, the nominal insurer tends to be, well, it doesn't tend to be, it is predominantly small businesses. About 80%, 90% of the employers that we insure in the nominal insurer are small businesses. And in those cases, simply changing the question of where do you want to return to work to can make a huge difference in the speed with which you get someone to work. Forcing a psychologically injured person to think they're going to go back to work at the same employer versus actually giving them the opportunity that they still want to return to work, but they just don't want to return to the same employer. And we've seen return to work rates of 8 to 12 weeks when normally you would expect that to be 26, 52 weeks in the normal cases. So small things are making a big difference is what we're seeing in that Test and Learn Centre. So there's a lot of activity going on, I guess, Mr. Tudorhope, and it is fundamental because, as you know from previously, it is the fastest growing element of the injuries within the scheme.
I know I'm restricted as to time, but I'll just finish. In terms of the claims managers, how are claims distributed between the, I think, 6 claims managers that are now on board? A great policy innovation, that, in terms of making sure that there is a fair distribution, hard cases, easier cases, and the like. So how is that process adopted?
So we made a deliberate decision in 2017. The model was about moving all claims back to one provider, and that created a whole lot of pain for injured workers who were disrupted from their strong relationships with case managers and their usual ways of working. We made a deliberate decision not to move open claims, but to actually allocate policies, so employers effectively, and that the new CSPs would then get the claims that relate to those policies. So we have done that, and we're still actually in the process. It will take through to June next year, at which point we'll be able to increase the level of choice for employers. But so we're actually allocating policies, if that makes sense, rather than claims. And new claims then go to with those policies, and the open claims stay with EML. That slows down, I suppose, the process of reducing our dependence on EML, but it's about ensuring those injured workers have stability and continuity. Yeah.
I'll finish there, but I just want to say to you, Mr. Harding, we're lucky to have you.
Oh, thank you, Mr.
Thank you, Mr. Tudor-Hope, and that concludes the questioning for today's hearing. And I'd like to start by thanking you all for coming and providing your evidence and responding in such a substantive way to the questions that were put today. It's very much appreciated, and your work as public servants is deeply appreciated by me, and I'm sure all members and the community. So thank you very much. For your witness today, your evidence today, all the witnesses. The Secretariat will be in contact with you regarding any questions taken on notice in due course. So thank you very much. You are free to go. Thank you very much, members, for your participation in this year's hearings. To Hansard, to all the Secretariat and all the people doing AV and back of house out there, thank you very much.